All right, I think we're ready to begin. Welcome to the Alaska Council on the Homeless. Our meeting is November 1st, 2018. It's a little after 1:15 p.m. For the benefit of the people in the audience, Governor Walker signed an administrative order earlier this fall that expanded the Council on the Homeless. So we have positions and individuals that weren't on the council previously. We have some folks that are different than the agency representatives that we saw on the council in our last meeting. So in lieu of having Jennifer call roll, I was hoping maybe we could go around the room for the benefit of everybody, and if you could give your name and your position and where you work, I think that would be beneficial. And I'll start. I am Brian Butcher, CEO, Executive Director of the Alaska Housing Finance Corporation.
Mike Abbott, CEO of Alaska Mental Health Trust Authority.
Good afternoon. I'm Sana Eford. I'm Deputy Commissioner for the Department of Education and Early Development.
I'm Dave Kuiper. I'm an Associate Director with Christian Health Associates.
I'm Susie Pearson. I'm a public member, and I'm from Abused Women's Aid in Crisis here in Anchorage.
Jennifer Smeared with the Statewide Homeless Housing Office and Administrator for the Council.
Brenda Stanfill. I'm the Executive Director of the Interior Alaska Center for Nonviolent Living in Fairbanks.
I'm Betty Svensson. I'm the Deputy Director of the Alaska Municipal League, and I represent the municipal governments on the council.
Scott Schomburg. I'm the Board Chair for the Alaska Coalition on Housing and Homelessness and the Chief Housing Officer for the City and Borough of Juneau.
Good afternoon, Nicole Borromeo, Executive Vice President and General Counsel for the Alaska Federation of Natives.
Good afternoon, Owen Harris. I'm the Executive Director of North Pacific Rim Housing Authority and the Regional Housing Authority Representative.
I'm Louise Dean. I'm the Acting Executive Director for the Alaska Workforce Investment Board, and I'm sitting here for Commissioner Dragas today, who can't make.
All right, thank you very much. As we go through the presentations today, because we have such a new council.
Brian, I'm sorry to interrupt. We have council members on the phone.
Oh, I'm sorry. Who's on the phone?
This is Jason Hahn, Chief Program Officer of Covenant House, Alaska.
Thank you for joining us, Jason. Just to let you know, Allison joined us in the work session this morning, so Covenant House was represented.
Very good, thanks.
And so as we go through kind of the presentations and update, generally what the council has worked on is a 10-year plan, a statewide plan for ending homelessness in Alaska. And it's a very broad plan that ultimately would include probably everybody in the room, as well as other people, impacting all state, federal agencies, nonprofits, faith-based, and it's a plan that I think that we can flesh out, kind of a living document more than just here's where we are, a snapshot in time, and something that gets outdated after we move past it. But we won't be spending as much time on that in this meeting. We'll be more bringing the different state and federal agencies up that we do work with, giving an update for the new council on where we are, and then kind of giving us a base that we can build off of into the future. So with that, I would like to take public comments. And I know that we have Homeless Coalition updates after that. So if you are giving an update for your coalition, we don't need you under the public comment period because you already have a slot. But we will open up public comments for anybody that isn't on the agenda.
Is Rose Hubbard available? Yeah. Yep.
My name is Rose Hubbard, and I'm a private citizen, and I've started the Anchorage Communal Homeless Camps Project. I'm looking into, I've actually written up an outline of a proposal for a communal homeless camp. I've also gone down to Brother Francis Shelter for the last 2 days, and I have interviewed about between 65 and 75 individuals that are homeless and gotten their input on whether they would or would not use a communal homeless camp because abating the camps doesn't get rid of the homeless camp issue. It just gets rid of that trash, and the people move on to the next place and the next place and the next place. And there are people out there that just in general do not wish to be in a shelter unless absolutely necessary, like it's freezing, and they have no gear to cope with the temperature. Or they have a partner and they can't spend the night in the place with the partner, and the only reason they are going into the facilities is because they want to live, and that's the only reason. So I think that it's very important that we get those people addressed. I would love to end homelessness altogether, but in reality, there are going to be people that are on the fringe and on the outskirts of our society that just don't conform to social rules and regulations. And this would give a safe, secure place for them to go. So when an abatement sign goes up, they could also put the address to this camp. And that way, there's not just, okay, we're just picking up and moving our stuff around town. It's picking up, moving it to a specific place. And in a campground, you can house and facilitate a lot more people than you can in a structure. There would be numbered campsites with fire pits, heated pavilions, electrical, bathroom facilities, and my vision is that at the end of a person's stay there, hopefully, they would have gained experience through becoming trustees and working there to get personal references, to start working other places, and so on and so forth until they have a meaningful position and are able to be gainfully employed. Honestly, nobody wants to hire somebody that smells like they just slept on the street. And nobody wants to have somebody working in their office or selling their products that isn't able to shave, shower on a regular basis. So this would be a solution to that. Also, I would like to have a greenhouse because gardening is a very therapeutic, and it would also help supplement the food supply to the people. The majority of the people that I spoke to that are homeless say that they would either allow the state of Alaska to garnish a portion of their PFD based on the percentage of time that they spent in the homeless camp that year, or they would pay on a sliding fee scale. So I have put together the proposal. I have a Facebook page and a website, and I will be posting the answers to those, the questions that I posed to the homeless individuals.
Okay, do we have any questions for Rose?
Rose, thank you. I just friended you on Facebook. Thank you. Do you have copies of your document here today? I'll take that one if you want to give me that one, but is there a way that the rest of the council members can access it?
Yeah, and I was actually going to ask at the end if you could give your contact information, website, and email to Jennifer, who's the staff person for the council, so we could distribute it.
Can I give this one to Jennifer?
Yes, and the document is also on the Facebook page. The questionnaire is on the Facebook page. I'm also going to be posting a questionnaire to the general public, city officials, people that interact with homeless on a daily basis in order to get their input. I need everybody's input to find out what is going to work and what isn't going to work from both the homeless people's side, which nobody thinks of them as people. You just think of them as annoying, ugly nuisances as you're driving down the street. And they're actually really, really interesting people. Some of them, yes, are just nuisances, and that's, you're never going to find a 100% solution. But I feel that we could do a whole lot better, and a lot of them choose to camp because they cannot sleep next to the individual that they love, or they don't feel safe not sleeping in their family group. A lot of them are from villages. So.
Okay, do we have any other questions for Rose? All right, thank you very much for your testimony.
So we don't have any other people who have signed up to do public testimony, but there may be somebody who missed the opportunity to sign up that would like to come up now.
Sure, come on up.
Hello, my name is Paul Frost. I was born and raised in Anchorage, Alaska. I've gone to school, graduated here, lived my whole life in Alaska. I've had opportunity to spend the last 20 plus years in Bristol Bay. My wife and I have been involved in youth ministry for 30 years. Some of the youth, the reason I'm so thankful to see everybody here talking about the homeless situation is because I thought I could make a difference. Came into Anchorage and I saw a couple of youth that I've known since they were 5 years old in Togiak, and they were homeless. And I asked them, what, you know, in a roundabout way, what's happening. They were invited to come into Anchorage for job training. And they thought that after the training, they would be able to apply for jobs, but they misunderstood. So they were given money by our native corporation to come into Anchorage and get training, but somewhere along the line, because they misunderstood, they fell through the cracks, and they did couch surf for a little while, but that didn't last, and they found themselves on the street. So I bought them something to eat and visited with them. That led to me taking some of my grandkids around and feeding the homeless by making sandwiches and hot soup and meeting where they were, just going where the homeless are. And I did talk to a lot of the homeless, and I did talk to an assembly member and some Anchorage police that were downtown about the homeless situation. I tried to get as much information as I could, and all I found out was it's a complicated situation. There's a lot of people on the street. Obviously, they're not all chronically homeless, but some of them are mentally challenged and every other way. And so I thought we could fix the problem, but I don't know that there's a one solution fits all. So my prayers are with all of you. It's a complicated situation. But in interviewing some of the homeless, asking them, I didn't find any of them asking for me to give them money. They were just thankful. The number one issue for all that I spoke with was their safety. They did not feel safe on the streets, which made me understand why they didn't want to go stay in some of the places that there are. So I started asking around where the old Native hospital was, which is similar to what was just shared. Can't we turn it into a KOA campground? Now, I understand there's a lot of issues with that, but it seems that as a taxpayer, we have places in Anchorage. I don't really want to pay to build homes for each individual homeless person. I don't mean to come across like I don't care. I do care. I just don't know that seems so expensive. And after talking to some of the homeless, there's not a one of them that wants a home. I mean, not the ones I interviewed or talked with or met with, but they do. The number one issue is safety, and a lot of them congregate in different areas. And I did think this would be an answer, but I'm not advocating putting dumpsters and porta potties where they congregate, because there's property owners, and I'm a property owner, and I don't want that as a solution. But aside from buying homes or building homes or providing places at that, whatever that expense might be, it seems a lot of them just want to be with who they're with, and they would like a place to take a shower and a place to eat, and then get on with the business of trying to live their life, I guess. And so I would lean towards, I suppose at this point, making a KOA type campground where it's fenced in, they have lighting and heat, and lockers to put their backpacks in, and little cards that they have to check in at a station when they go in for safety reasons. That would be it. And but I realize that there's a lot of legality and a lot of other liability that comes into any decision you make. So I just wanted to say I applaud all of you. Thank you for being here and doing this, because I thought I had an answer, but the more I dug into it, the more complicated and complex it is. And so, but I will pray for each of you. Thank you very much.
Thank you. Do we have any questions for Paul?
Hi.
Hi.
So I'm listening to, you're saying these are youth. You were in particular mentioning some youth that were in Anchorage here. Just more of an awareness that if they're youth, are they school-aged youth? Are they youth that had not graduated yet? Or if they should be in school, there may be some opportunities for them that I'd like to maybe talk personally with you or see what we could do to help. So.
Thank you. They're out of high school, the ones that, one of them didn't graduate, but they came in to get training, and that's where I thought I'd like to focus on, is maybe preempting becoming chronically homeless by addressing some of these young people. I'm thankful for the Covenant House and what they do, and whoever is involved in helping youth. I actually believe that if we step into their life in some way, that it would be helpful, and they might not just get so depressed and bummed out that they're just giving up. I think some of that issue has to do with homelessness also, in addition to mentally challenging. There's just, it's complex. You guys, I applaud you. Thank you.
Any other questions for Paul? All right. Thank you very much for your testimony. I think you really hit the nail on the head that what makes it so complicated and complex is there has to be many, many solutions. There's not just one. If there was just one, I think it would be solved.
Yeah. Thank you.
Thanks. Any other members of the public? All right. Let's move to the reports from the coalition. Let's start with an update from Mike Sanders of Fairbanks. There he is.
Hi, everybody. I'm Mike Sanders, Housing Homeless Coordinator for the City of Fairbanks. Thank you for allowing me to present. So I'll try to keep it brief. there is a lot going on in Fairbanks right now. I'm sure most people on the board realize how incredibly active the Fairbanks agencies have been over the last year, and how incredibly busy they plan on being in the future. It seems like almost every large agency that we have there is doing some sort of expansion, and all the smaller ones are starting to expand as well. It's really a great time to be in Fairbanks. We're starting to get a lot of stuff going. One of the big accomplishments that we have that just started today actually is our coordinated entry system. I remember the first time that I presented to this board, I was really skeptical if we were going to be able to get it going in Fairbanks. To be honest, it wasn't a very popular thing, and but since then, the agencies have all come together, and they've really, once we dug into it and realized that we could set it up to be an effective system for our community, they got behind it full-heartedly, and as of today, our access points are allowed to start collecting data, and we should start case conferencing very shortly. So what we're doing with the coordinated entry right now is we're recommending that for our clients that need rapid rehousing and permanent supportive housing. We're taking it, baby steps. It's not one of those things where everybody that is at like at an emergency shelter needs to be in coordinated entry. A lot of folks they'll self-resolve or they'll prevention diversion. They'll be able to get out of the system before the coordinated entry system could act. So right now we're really saving it for our rapid rehousing and permanent supportive housing, but. IAC and VL, the Center for Nonviolent Living, the Tanana Chiefs Conference, and the Limits Inc. are all participating in it for permanent supportive housing units. And the Fairbanks Rescue Mission is participating with their rapid rehousing units. So that's the other thing that's pretty exciting in Fairbanks. We now have a general population rapid rehousing program. It launched, kind of unofficially last week, but it was a long time coming. It was something that we identified last year, and I'm sure most people on this board remember we had the Fairbanks Symposium on Homelessness in December of last year, and it was well attended. We had about 200 folks there, and we had a lot of the people that are sitting here today were actually in attendance, and it was all about rapid rehousing. We had like 200 people come together from the community to talk about how we can make that happen there, and the very next day, we had 6 agencies get together for a day-long meeting about, all right, well, we talked about it yesterday, now let's actually make it happen. And that number of 6 agencies grew to about 10 over the course of a couple months. And it was the most collaboration that I've personally witnessed between the agencies. It was great. We had, like I said, 10 agencies coming together, and it wasn't like they just came together for a meeting and kind of checked the box. They were sending information in. They were, they'd bring information to the table. They would, talk about, hey, let's design it this way. And basically, what we came up with was we wanted to model this general population rapid rehousing program after the SSVF model. Only rather than being just for veterans, it'd be for whoever. And we decided to use all the National Alliance to End Homelessness and United States Interagency Council on Homelessness standards and benchmarks. And we decided that we needed to fill this using the coordinated entry system and dynamic prioritization. So even though the coordinated entry system is just now collecting data, we didn't want to wait any longer for our rapid rehousing. We thought it would take us longer to get it going. We actually got that program up and going fairly quickly, and it was already staffed, already funded. So we decided to go ahead and launch it without the coordinated entry system, and then as soon as coordinated entry system's in, then we'll start using it with like I said, dynamic prioritization to allow us to house the most vulnerable people using the rapid rehousing program. Another big thing we have going on is we also, I'm not sure exactly how this came to be, but Fairbanks was recommended for and is receiving federal technical assistance from the Technical Assistance Collaborative, who, as I'm sure most people here know, wrote the Alaska Supportive Housing Plan, and ICF and Collaborative Solutions. Now, this this started a couple months ago. It's all been webinars so far. They've been getting with the agencies, and it's been a lot of presentations and stuff. But the last week of November, they're going to be up, and they're going to be trying to help us expand the service bubble in Fairbanks. Their goal is for us to take the great services that the agencies are already doing and expand that further. Because one of the things with coordinated entry is we're now the referral zone for all of interior Alaska, which, as you know, is the size of Texas. I mean, that's a huge area. So we definitely could use the help with expanding our services. Getting stuff to not just to North Pole, which will be easy, but getting out into the villages and actually being able to help folks there as well. But their mandate for the technical assistance is they need to develop 15 permanent supportive housing beds and 40 rapid rehousing placements outside of the city limits of Fairbanks. When they first came to us with that, they asked if it was something that we could do, and without hesitation, the agencies in Fairbanks, they decided that they could. They stepped up to, yeah, we got it. So I'm extremely proud that they were able to do that, and hopefully this time next year when we're wherever this conference will be next year, I'm telling you that we expanded 15 permanent supportive housing beds outside city limits and 40 rapid rehousing placements outside city limits. And that brings me to the next thing that is on our plate. The biggest service gap that we still have in Fairbanks that is just glaring is we have a lack of behavioral health and mental health services. It has been a rough couple weeks in Fairbanks for that. The hospital is overflowing. They're holding patients for multiple days, and in the emergency room, we've had 2 standoffs in the last week or so. With somebody who's having a mental illness. One was, threatening homicide and suicide, and they had a hostage. We're desperate for more behavioral health services in Fairbanks. So one of the things as a coalition that we have done is we decided, since the last symposium worked to get us rapid rehousing, let's do another one. We're going to do it in February. And our focus this time is on getting an assertive community treatment team and/or a intense case management team up to Fairbanks. It's something that we desperately need. During our point in time count, which was January 23rd this year, it was 30 below when we started that count, and we still had 48 folks that we found that were most of them were living in encampments, but we also had people that were living in the vestibule of Mount McKinley Bank. We had a gentleman who was staying in his cardboard igloo that he's been staying in since like 1992. We have that need for behavioral health that can be delivered to the person rather than that person having to be brought in to make an appointment, or because that's just not going to happen with a lot of the clients that are out in the cold when it's 30, 50 below, and they won't come in for an appointment. But if we could take the services to them like an ACT team or an ICM does, then I think that would definitely help eliminate our biggest need for our most vulnerable people in the community. And I believe that's all I have. So.
All right, thanks, Mike. Before I ask for questions, I have to say that I've heard from legislators up in Fairbanks all the way to Alaska Housing's chairman, Brent LaValle, about what a great job you're doing up there. So just wanted to let you know I get a lot of input about the good work you're doing up there and wanted to make sure you knew it. But
thank you. It's literally all the agencies. I have the easiest job in town. So.
I'll let them all know.
Yeah.
Do we have any questions for Mike? Yeah. Scott.
So thanks, Mike. So I'm really excited about your TAC consultation that's coming for the community.
Mm-hmm.
It's fantastic. So any early thoughts on how you'll be able to provide the supported housing supports outside of Fairbanks city proper with the current relationships in town? How do you think that may play out?
Well, I think that that's not going to be as hard as it sounds. To meet their intent, we could, the city limits is actually fairly small in Fairbanks. Out of the 100 and something thousand people that are in the area, only like 29,000 are actually in city limits of Fairbanks. The actual city limits are small. So you know, I live and work in Fairbanks, if you ask me, but my house is not in city limits. You know, a lot of people aren't. I think it will be easy for us to expand out either in the you know, the immediate area outside of Fairbanks, or expand out to North Pole. And you know, initially, I think we need to start growing our bubble of service slowly. You know, I think we should start. I think we should start in North Pole. Personally, I think that's our next community that we should really jump to, and it would be easy. I don't want to talk for different agencies that are here, but I think our agencies would have an easier time making that leap to. You know, to like a North Pole or something like that, rather than, you know, jumping straight to the villages. Although the villages need help as well, but I see this as a continuing thing that we will continue to grow our services.
Okay. Any other questions for Mike?
Thank you.
All right. Thank you very much. Next, Rhonda Schneider, Nome.
Hello, Rhonda Schneider, Executive Director of Nome Community Center in Nome. We're a small nonprofit that manages several social service programs, and we've recently taken over operations of our winter shelter, the permanent supportive housing, and homeless prevention efforts that small organization was managing on their own. I think that when we've had opportunity to speak before the Governor's Council, for legislators, it seems like we're saying the same thing over and over and over again, that there's not enough housing stock, that there isn't enough low-income housing, that building materials are expensive and shipping is expensive, and there are high energy costs and things that contribute to the homeless situation in all of our communities, and those things still exist today. However, I think that for a lot of our communities, we have some creative ideas on how to start attacking those issues, and we're limited by the constraints of some of the funding regulations and some of the things that prevent us from being able to make some modifications. For example, in our permanent supportive housing units, we could put a bunk bed and could house 2 people who are used to living in small quarters. But we can't because of the regulation. If it's an efficiency apartment, you can only put 1 person in. So instead of housing 6 people, we could house 12 if we could have a waiver or an accommodation. And so I think in communities where we are just learning about some of the funding sources that are out there that we haven't had in our back pocket in the last number of years, we found creative ways to make some of the systems work that we know will help us house people or take care of homeless people and keep them warm in the wintertime. We did it without funding, with volunteers for years and years. And so I feel like we need to be thinking a little differently about how we spend our dollars. So we know in an overcrowded house, the environmental conditions of that house are causing respiratory problems and health issues that are really taxing our healthcare system and costing us a lot in terms of healthcare dollars. So funding that would allow us to add a room onto a house to accommodate additional people instead of having to build a whole entire house. It would cost a whole lot less to add a room and not have to have all of the facilities to satisfy water and sewer and those kinds of things, so that people can continue to live together, but in a safer environment, would reduce the costs of health care, for instance. We know that the outcomes in our classrooms with children who come from overcrowded homes where they're not getting adequate sleep have behavior issues, so then they need classroom attendants and different supportive services that cost a lot of money to provide the educational system. And so if we can put more dollars into providing space and safe places, quiet places for kids to sleep and do homework, and so putting money into Boys and Girls Clubs that are providing tutoring and services, and transferring some money that's currently being spent on larger systems that are putting more money into trying to solve the problems that have been created because we don't have enough money to solve the root problem, which is housing. So my message before you today and before every group I get to speak in front of is let's consider spending our money differently. Can we, for rural communities, for small communities, consider waivers to some of the regulations that prevent us from being able to be creative in our own communities, to use resources differently to take care of those needs. The amount of subsidized funding for apartments, if an entire building is subsidized versus one extra unit that a private landlord might make available for a subsidized rate and a break to that landlord in some way, those kinds of things I think we could capitalize on and be more creative. The other thing I would like to mention is that I think for a lot of the small communities in Alaska, our point-in-time count have really hindered our ability to receive the amount of funding that we could get if those counts were accurate. And so, again, it's just managing money differently, getting more money in by doing counts accurately and being creative even in how those counts are gathered. Some of the things that are happening in Nome and in our region, we've been operating our winter shelter. We're starting our 9th season actually tonight. We'll be opening up, and we've been partnering for years with our faith-based community to provide soups and some of the food that they provide. We've been able over the years to transition from a completely volunteer organization to paying our advocates to support our guests. We are very, very excited that our tribal health system has joined forces with us to evaluate the effect on individuals who spend the day on the street. So we have our night shelter's been operating successfully to keep people housed and warm. And we haven't had any deaths since we've opened our shelter, and so that's notable. But our day shelter will be opened up and supported by the tribal health system. They will open during the day and be complementary to our program. It's a 6-month pilot, and we expect that we'll see enough results and positive outcomes to ER visits and some of the other things that we've been talking about today that we know impact for those of us that have been working in this field for a while, and we're looking forward to gathering a lot of really good statistics that will help us keep that project supported. We have supported a permanent supportive housing project for the last 2 years, and we've finally been able to transition some folks out of that and some new folks into it. So our hope is to expand that a bit. We've not gotten into rapid rehousing. We haven't found the resources and support that we need to establish that, but we are looking forward to developing a housing coalition. We don't currently have one. We just have a lot of interested parties and community members who know we need it and get together for meetings when we have opportunities to talk about some housing options, building opportunities, and projects that are available. So we're looking forward to that. And we want to begin a Housing First project. We know we have a need for it. We think we have land available, and it's just going to be a matter of human resource to help us apply for funding and consider how we can get a project like that off the ground. I do want to mirror Mike's comments about behavioral health support. So we recognize that the load on our community for behavioral health support is weak or is high, and the supports to help us out are weak. And recently I learned that there are 87 vacant clinician positions in the state of Alaska. And so a little community like Nome has a real hard time competing for clinicians to come to our region. The loan repayment options and things that were available to them at one time are kind of shrinking, and so the attractiveness for educated folks in that field to come to our communities is a little challenging for us. So that is something that we face, and I think it's a challenge for other communities in the state as well. Questions?
Okay, thank you, Rhonda. Do we have any questions? Oh, Nicole.
Thank you, Rhonda. Can you tell me a little bit more about the day shelter and how that's working up there?
So they were hoping to open on the 1st when we opened. They were hoping to open tonight, but they need a couple more weeks to staff the right staff. They are attempting to hire what they're calling recovery coaches, and they're looking to hire recovering individuals who will be able to reach out to folks. When they leave our shelter in the morning, they're sober. And so we're hoping they will have to leave our building and move to another building. So that's definitely something we need to measure, is the effectiveness of having it in a different place. Will they go right there, or will they go somewhere and start drinking before they go there and need a warm place? The program is designed with several rooms, a sleep-off room for folks who need to continue sleeping. There will be a room for day activities, games. They are hoping to include subsistence activities and native crafts, and partner with community individuals who have those skills and abilities and willingness to share those things. They will also have a counselor available 3 or 4 times a week who will be stopping in. They will have speakers coming in. They will, the recovery coaches will be trained to help connect folks with the Department of Labor and job opportunities, do some job coaching and counseling. They'll provide a lunch meal. So our winter shelter provides soup in the evenings when they come in and breakfast in the morning, and the day shelter will provide lunch. So hopefully, by stretching hours for both programs, there will be maximum of 3 hours a day where there won't be some shelter for folks. So we're hoping for some good results. We hope they'll be open within the next couple of weeks.
2 follow-up questions.
Sure.
Who's running that program, and what's the capacity?
So Norton Sound Health Corporation is our tribal health organization for our community.
Okay.
And capacity would...
For beds or
So they're just going to have a couple of mats in the one room for additional sleep off, because most of the folks when they leave our shelter are ambulatory. They walk, they leave on their own. They feel like they can accommodate up to 40 people. Mm-hmm. That seems probably a high number in the daytime, because a lot of our folks don't want to be inside. I think they'll come in when the weather's bad. I think they'll come in for lunch, but I think they'll wander in and out, and they'll have the freedom to wander in and out during the course of the day.
Okay, thank you.
Mm-hmm.
Do we have any other questions? Yep, go ahead, Brenda.
Hi. So you had said if the point-in-time count could be done accurately. Can you tell me what the challenges are that you're facing in trying to get that point-in-time count done?
Yeah, so one of the things I discovered, it was a long learning curve to take over the shelter and the operations and learn about the point-in-time count, and talking with some of the colleagues in this room. I've learned a lot about how those numbers, how those counts are taken in other communities. So our count was being taken on the given night in January, and it was only counting the folks that were in our winter shelter. And so we have a domestic violence shelter in our community. They were not being counted. We have folks who weren't coming into our shelter that night who weren't being counted. We have several homes that we know of where there are 6, 8, 9 individuals who are homeless. But when one person gets housed and invites their friends in, we know about some of those. And so we want to do some more intentional outreach to some of those places where we know folks are. Some of our community partners and some of the staff members that work within some of our own programs, we're in and out of some of those houses, and we know where those folks are. And so we want to capitalize on that and get our count to be a little more accurate. We'll still miss some. There are plenty in our village communities, 15 village communities that are part of our region that we don't have a way to reach out to and count, but engaging with them and developing a plan to include some of them in our counts, and maybe over the course of the next 4 or 5 years, be able to say that we have accurate counts for the entire region would be our goal. Mm-hmm.
Do we have any other questions? I'd just like to comment, Rhonda, that I agree with a lot of what you've said about the challenges of rural Alaska, and it's very specifically why in Alaska Housing's permanent supportive round of capital and operating funds this last year, we have put in a rural set-aside to make specifically sure that we understand the challenges and we focus on them rather than just, scoring projects that come from the same. Every community needs the help, but we need to make sure that we make sure rural Alaska is not lost in that.
Yeah, we're very, very grateful for the work that Senator Murkowski has done to bring some attention to some of the housing issues, and the ICH, US ICH visit to Savunga. One of the things that, even as a community member in my own region, until you actually see it and experience it yourself, you can hear the statistics, you can see the pictures, but until you actually step on their ground and walk into their house and shake hands with them and hear their stories. It's really hard to conceptualize. It's really hard to imagine. And so when folks who are further removed from it or who have never experienced it see it for the first time, it's a real opportunity for us to make people aware of what's really happening out there. So appreciate that. Appreciate your support.
Yeah,
Thank you.
thank you. All right, Leslie Rohr from Kenai Peninsula. I hope I pronounced that correctly. Okay, good. Welcome.
Thank you. I'm Leslie Rohr. I'm the Executive Director of Love in the Name of Christ of the Kenai Peninsula, and I serve as the chair for the Kenai Peninsula Continuum of Care. The Kenai Peninsula believes no one deserves to lose hope. So as an organization, as a group of agencies concerned, our Continuum of Care has come together over the past couple of years, building on our project Homeless Connect. Last year, we had 119 individuals who filled out the application or the questionnaires on Homeless Connect Day. They represented household numbers of 320, and 68% of those, that was the first time they were attending a Homeless Connect event. I had a visit from one of our candidates for Lieutenant Governor, and he mentioned that didn't seem that we had a homeless population on the Kenai Peninsula. And I had to say, graciously, I have to disagree with you. Love in the Name of Christ has had 345 unduplicated homeless individuals come through our doors since January 1st. We have 135 students district-wide. 42 of those are unaccompanied minors. We have a homeless population on the Kenai Peninsula, and we have no homeless shelter. We are a second-class borough, meaning that our borough government does not provide services for providing shelter for homeless individuals. Neither one of our major cities, Soldotna or Kenai, take fondly to camping, so campsites are torn down just as quickly as they go up. We have one homeless shelter for men that serves about 10 men. They cannot be disabled. They have to be able to be seeking employment. So it's a very limited number of people that they can serve. And then we, of course, have South Peninsula Haven House and the Lee Shore Center for domestic violence, sexual assault victims. If you are an intact family and you're homeless, you have nowhere to go. So as part of our continuum of care and through my outreach with Love Inc. and the faith community, we decided this year that something needed to be done. We've given a lot of lip service over the years to the fact that we have no emergency shelter. We need to do something about it. So we formed a shelter development work team, and we're getting ready to have our third meeting, which will be next Thursday night. We identified that families with children and unaccompanied youth were the two priorities that we really wanted to look at in providing housing. We became aware that the faith-based community was ready to be involved and to step up. I have 5 churches who have stepped up to say that they will open their doors for cold weather shelter for the evenings. So that is something that we'll be reaching out to Matsu Family Promise for some guidance with that, and anybody else that has any guidance that they can offer us in getting those 5 churches set up. We, like we're not quite as spread out as Fairbanks, but we cover, 25,000 square miles and on the Kenai Peninsula, and our population is about 58 to 60,000. Some of our places, our villages are reachable only by air or boat. So it makes serving those areas very difficult. And so people tend to migrate to the Central Peninsula area for services, and that puts a bigger burden on the services that are available within the Central Peninsula. I can tell you that since January of 2018, Love Inc. has provided housing assistance in rent and rent deposits for 87 families. That's 87 families that were either on the street homeless or at risk of being homeless imminently. So, and emergency lodging is another one that we do, and I think we had about 30 people that we provided emergency lodging for last year. But the funds are limited, and we are so grateful for the BHAP grant that we get, but it never quite goes far enough. And I know it's the same thing for everyone else. I just encourage everyone to continue the good work and to even HUD has a definition for being chronically homeless, but we know that there are a lot more homeless individuals out there than just those who qualify under that chronic description, and we want to serve all of them. And thank you for all that you do.
All right, thank you. Do we have any questions for Leslie? Thank you.
Susie says I should talk to you about emergency cold weather sheltering in churches.
Yes, please.
Okay, so we'll talk.
Thank you.
All right, Dave Rose, Matsu Coalition. Welcome.
Good afternoon. My name is Dave Rose. I'm the coordinator with the Matsu Coalition on Housing and Homelessness, obviously out in the Matsu Valley. I'm passing around to you a supplement to the report that I turned in, and I want to thank Jennifer for doing a wonderful job of pulling out bits and pieces, and thank you to the council for the format. Housing development, supportive services, education, engagement, policy, prevention, and data. It's all a part of it. It's all got to be addressed. It's not a simple issue. And in a moment, I'm going to ask the choir to sing with me. Again, last year I took the time to say thank you to all of you. And I'm going to do that again. We could not do the little bit we do to make a dent in homelessness without the funds that we get, without the research that's done nationally as well as statewide, without state coalitions, without state housing finance corporations, without all of you. And so thank you very much. Alaska Mental Health Trust Authority, I'm a little jealous. I'm still trying to figure out how to get a housing coordinator position funded through you guys. It's not your fault, it's mine. But seriously, that's why we're able to do the little we are able to do. And I was going to start off today saying we need to change the title. I've been in this business long enough now that I'm not sure there is an end to homelessness. We've heard from several folks some of the reasons, some of the complications, some of the unique characteristics that go into homeless individuals, that go into families that are on the edge. It's complicated, and I still love the concept of ending it, but to be challenged to work ourselves out of a job is a great challenge. we're going to all have jobs for quite a while. That's not being pessimistic. That's just somewhat being a little more realistic. I hope you'll take the time to glance through this. This is from our data. And I love this because it gives me the talking points that Steve Williams suggested last year. Go out, raise community awareness, tell people what's going on, help inform them so that they can and will become involved. And that's been my overwhelming experience. I come from a very conservative part of the state. I'm very conservative. But when I hear of and when I meet families and individuals, and especially youth, children, who are experiencing homelessness or are on the edge of becoming homeless, it moves me. And I'm a caring person as well as a conservative person. And it causes me to step forward and say, what can I do? And I'm especially thrilled with our church-based and our faith-based organizations that are stepping forward and making a difference, because I believe there's a mandate there. And in the Valley, we are moving forward to challenge those folks with faith to step forward and work with that mandate, as well as others. I just wanted to highlight a couple of things in our report that we're doing. Valley Residential Services out in the Valley is doing an awesome job of managing low and affordable housing. They've recently come into partnership with AMG, Cameron Johnson, who's doing an awesome job of finding a way to make affordable housing economic. Who ever thought of such a thing? He's making money on building affordable housing. You wanna encourage affordable housing? Show people how it can make them money. You'll get investors. You'll get private people saying, well, I want a piece of that action. Out in the Valley we have, and I'm gonna blank because I didn't write this down, Yunt Homes, Rented the Valley, these folks who will sell you and then build for you a fourplex, separated fourplexes. If you have an acre of land, they will build four individual small homes on there. They'll show you the economics of it. You can rent out 3 of them and live in the 4th one for free. You know what? That makes sense to a lot of people. We've got those things popping up all over the place. What's the same concept that we use when we do landlord luncheons? You've got a 4-plex, you've got an 8-plex, you've got a 10-plex. Think of the good you could do if you took 10% of your units and allowed us to introduce clients that will work with you to help them be responsible clients. And we'll even support them with some financing initially so that you don't have to worry about that. We might get AHFC involved and you'll get a guaranteed check. Landlords listen to that kind of thing. And especially if we do see an out-migration of folks from Alaska. In some communities, they've already seen that. Overall, we haven't seen that. In the Valley, we've seen an out and an in, and the overall income levels starting to go down, okay? So that's gonna mean, okay, we got the same number of people, but they've got less money. Guess what? We need more affordable housing. Everybody does. If we're able to find a way to make it economically feasible, the public will fill that gap. And so far they've started to. We need more. That's not to say we don't need your help still, but that's the avenue we're focusing on. To be perfectly honest, and my boss isn't here, so I can be perfectly honest with you, coordinated entry is a leap for us, and it's difficult. We have, what's the phrase? We have, what do you call it? Picked the easy fruit? Yeah, that's it. We've picked the easy fruit. We've helped with, and it's not easy, but it's easier. Rapid rehousing, we do that. Emergency Solutions Grant, we figured that out. Homeless prevention, we do that without even trying. That just makes sense to us, okay? Saving tons of money. Coordinated entry, we kind of thought we had that down, and then they kind of reshuffled the deck on us. Now, VI SPDAT, okay, we're learning how to do that. But dealing with folks that are in the top 10 of our list of 50, that's going to be a challenge. We've had some training. We're going to need more training in behavioral health. We've had some training. We're going to need more training in how to prevent the issues that are going to come up and always come up with folks who don't see the world the same way you and I do, or with folks whose brains are slowed down or sped up on alcohol or drug abuse, or mental illness that's set in because of that. Alaska Mental Health Trust, thank you very much for the trainings and for the help and for the support you give us with those areas. I'm just being brutally honest with you. We're finding a way to do it, but we're going to make mistakes along the way, and it's not easy for us. Okay, enough said. We are getting creative, and it's, again, because of some of the stuff you guys are doing. You were suggesting that everybody needs an emergency lodging of some sort, emergency housing, and how are you going to do that, and what will that look like? And it's been great to hear from other coalitions, other areas of the state. One of the things we're working with is talking to churches, talking to faith-based groups. Would you set aside a room that has an outside entrance, and we're getting creative, and a keypad entry, and so that when the police get someone on a Friday night and they need a place to stay, the police would have the code, the police would screen this person, they're not high on drugs, they're not high on alcohol, they're not a danger to others. Punch the code, they go in and they sleep on a mat and they're warm and they're safe and they're okay for the night. Makes sense. And the church, please make this room, and we're going to try and have one in Palmer and one in Wasilla and one out toward Big Lake. Make the room austere. Is that the right word? Yeah. So that if there is some illness, or if there is some late night projectile vomiting, it's easy to clean up the next day. But even that's difficult. Because then the next question was, well, what if they need to stay there Saturday night too? Oh no, this is just for overnight. Well, then who's going to kick them out? I mean, who's going to let them out in the morning? Oh, well, there's going to be a poster on the wall that says you must leave by 8. Nobody has to be there. Yeah. Okay, anyway, enough said. We're working on it. And you know what? We wouldn't be working on it if you weren't encouraging us to do so. Okay? And honestly, if there weren't dollars tied to it down the road, possibly, this is how we're going to support it. And again, economics, you're going to hear that from me because I'm a conservative. Economics drives a lot of this stuff, whether or not we want to admit it or not. I'm a Christian and I want to do the right thing, but I can't empty my bank account. I got a lot of friends who care about people, but they need support just as we all do. So again, thank you for what you do. Keep doing it. And talk to us. I've given you my card. I've given you our data sheet so that if you have questions or if you have suggestions, please send them our way.
Thanks, Dave. Do we have any questions for Dave? Yeah, Brenda.
Hi, Dave. Hey, do these numbers include your domestic violence shelter done through Alaska Family Services?
They do. They're protected. So the numbers are there, but they're protected in there. In other words, nothing from that is ever publicly shared other than numbers.
Any other questions? All right, thanks, Dave.
Thank you.
Next, Tyrell Rutke. Tyrell? All right, if he comes back in, we can move him, we can pick it up then. Juneau, Irene Gallion.
Hello and thank you. My name is Irene Gallion. I'm Juneau's Housing and Homelessness Services Coordinator. I'm Mike's counterpart up in Juneau. And I'm here on behalf of the Juneau Coalition on Housing and Homelessness. And what I'd like to talk to you today about is some of our ongoing successes and some of the plans we have for the next year. If you guys were around for the lunch plenary, you got to see some of our numbers on Housing First, and you guys are probably familiar with that from the last time I was here. One thing that I can't overstate the importance of is having an autonomous entity review the project and the numbers and the successes. If you saw Morgan Arisman, she's come up from street outreach. She's now a behavioral health technician. She probably knows the continuum of the personalities there better than anybody else. And then Heidi, coming along and supporting her in her education. When they got the 6-month numbers, Heidi was out on the junket. She talked to everybody, Chamber of Commerce, the Assembly, Rotary. She made sure everybody knew what was going on, from accessibility to the common man to people who are really interested in data. So having those guys do that project really helped with advocating for it. So now we're in a position where the City and Borough of Juneau has provided a $1.8 million grant to get started phase 2, which will be another 32 beds. Bartlett Regional Hospital has provided $250,000, and GEMA, the Juneau Emergency Medical Association, that's a professional association of doctors and nurses working in the emergency room, themselves provided $15,000. They were that invested in the results. So very excited about that. Another project you guys may be familiar with from last year is our cold weather emergency shelter. We have a request for proposals out right now, and I think it closes today, and we'll see who proposes to manage that for us this year. The scenario is we'll open it November 15th. Folks come in at about 11 o'clock at night, go straight to bed, get up at 6:30. Because we have kind of a tight scope, it's just to keep people warm on very, very cold nights. It's been pretty easy to run. Now, we do have providers who are interested in expanding that a little bit, maybe using it as an opportunity to do some case management, maybe opening it a little earlier on some super cold days, and we'll see what happens when we get those proposals in. As far as upcoming projects, we are partnering with St. Vincent de Paul on the Community Development Block Grant, and they are developing the Dan Austin Center. I don't know if you guys know, but Dan Austin was the general manager of St. Vincent de Paul and passed suddenly in July. And the center would be basically robust support for our street outreach folks, offices for them, a place where people could go and wash clothes, take a shower, maybe store some stuff, and also look at housing resources, job resources, that sort of thing. Another really exciting project is with our partners over at Central Council Clinic at HIDA. They are putting together reentrant housing, 12 to 15 individuals coming out of incarceration. They're doing this with one of their, I think, premier downtown properties. It's over by the Whale, if you're familiar with Juneau. And they're going to use that waterfront access to have cultural healing elements to recovery. Very exciting. And their economic development wing has been involved with coming up with some job opportunities for folks, including their Sacred Grounds coffee shop, and doing some work with auto detailing. So kind of some neat opportunities there. We are leaning heavily on the experience of Fairbanks to the very nascent pursuit of a rapid rehousing project in Juneau, and we appreciate their hard work. I was very glad to hear Mike say they're working on an ACT team, because that's kind of our next thing. With any luck, we can just let them do the hard work and we'll follow them. But to kind of back up what Mike and Rhonda were saying in particular, one of our biggest challenges with keeping people housed is support for them, in particular mental health supports. We can get people housed, but if they are disturbing their neighbors, if they are not taking care of wound care or other physical needs, if they are not paying their rent, they won't be there very long. So those support systems in place would be a huge help. Now, one of our providers in town partnered with the Department of Behavioral Health to go for a national grant for an ACT team in Juneau. And just to give you an idea of the cost, for a complete ACT team, we're talking 24-hour psychiatric, behavioral health technicians, case management, health management. That was about $1.3 million a year. So a very big ongoing cost if that's the degree to which you want to do it. So something to think about. I gave you guys a folder here. It has basically a summary newsletter in it. That newsletter is designed for folks like you. What I'm aiming to do with that is give very busy people an overview of the important things that are going on. So if you look at that and you're like, there's some stuff missing, I'd like to see this presented differently, please let me know. We've also got an illustration of the housing spectrum in Juneau, from affordable housing to workforce housing, because homelessness is part of that spectrum. So just to illustrate to you guys what we're doing throughout that. And then finally, one of our librarians is working with the Alaska Humanities Forum on their Tinder Talks, and they're going to be doing 3 Tinder Talks in our community about homelessness. So looking forward to seeing those. Anyway, I want to thank you guys for your support and happy to take any questions you've got.
Thanks, Irene. Do we have any questions for Irene? I do want to say I think it's a great move to name the center after Dan, with all the passion he brought and everything.
Yeah, it was a huge community loss.
Yeah.
Yeah.
All right, thank you. All right, Jasmine Kahn, Anchorage.
Good afternoon. So this is my first time, and I didn't realize I didn't need to prepare a PowerPoint, so bear with me. I am the new executive director of the Anchorage Coalition to End Homelessness. For those of you I haven't met, I've been in the job for about 6 months. Very happy to be here today. When we talk about what Anchorage has accomplished in the last year, I think what rises up for me, and it's really been the product of the last 6 months of my time, is our new community plan to solve homelessness. Much to the point earlier made, I think we've all recognized that using the phrase ending homelessness comes with a lot of loaded context, particularly for the larger public. And so one of the things we're really looking at in Anchorage is how do we capitalize on best practices and better definitions and vocabulary that have worked in the lower 48. So solving homelessness for us is about getting to what we're using the term functional zero. It's a term a number of other communities have utilized. And essentially what that means is that there's a capacity efficiency. So the number of folks you have experiencing homelessness at any given moment in time is less than your community ability to support people experiencing homelessness at any given time. Now, the definitions are actually highly complicated, but I'm oversimplifying for my own understanding and ease of sticking to the time limits. Anchored Home is really about taking the federal plan on ending homelessness, our state plan, and the local plans that we have in Anchorage, and coalescing them in one place to create one tactical roadmap and to really focus all of our resources as a community on the sort of areas we've already chosen to address in one capacity or another, but putting them together and creating a timeline, creating an operational plan, truly that tactical roadmap. We've divided the work into 4 pillars. I'll go through this really rapidly, but there's all sorts of videotapes of our presentations on this. Essentially, I think what's really important is when we put together this plan over the course of this year, we've actually had a number of different community engagement sessions. We are trying very hard to make sure that Anchored Home is not a provider plan, it's not a municipality plan, it's a community plan, meaning we want the public to own the plan as much as our group of constituents through the coalition or through the provider community. So some data, this is a bit dated, but as of October, the beginning of October, we had met with over 700 community members to talk about the plan. It was quite a busy period of time. There were formal gatherings. We met with the HAND Commission, for those of you that are familiar with that, the Assembly Committee on Homelessness in Anchorage, a number of community councils. I will say with 100%, from myself at least, every single individual or group that has asked to talk about homelessness in Anchorage we have met with to date. There's a couple people that asked today. I'm still working on that. But essentially, I think what's really critical, again, is hearing the community. If you read ADN, there is an article or an editorial every single week at least about the encampments, about the visibility of homelessness in our community, and people's perception that that visibility is changing, and not for the better. And there's also some interesting logic gaps, because the same folks that will talk to me about the need to stop homeless encampments and the need to do that abatement are the same folks that say, but don't tax me. So it's interesting to try to understand where people think those resources are coming from, and quite educational, I think, when we take that seriously and we invite the community into our space to have those conversations. So when we talk about the plan, as I mentioned, we divided the tactics into 4 pillars, again, to make that accessible to the community, but to also increase accountability by removing the confusion and the vagueness of some of our large plans and really saying, here's what we're telling you we're going to do in the next 3 years, and clarifying who and how that's going to be done. We imagine better partnership with the public at large. So a piece of this is, of course, prevention and diversion, and some of that is strategic. Some of that is understanding what are the levers in Anchorage specifically that are influencing homelessness and increasing it, whether it's truly increasing it or increasing the perception of it. There's the housing and support system, which the coalition is going to be leading the charge on, in coordination, of course, with all of our providers. And I'll talk a bit more about this, but this essentially is we need to increase capacity of our service and housing provision, but we also need to increase our infrastructure capacity and our better data-oriented understanding. We had a beautiful lunch plenary from the folks at Forget Me Not who really underscored, I think, the importance of having good data when we're talking about systemic change. We have got to stop playing whack-a-mole with homelessness in Alaska, and I would argue around the world, but I'm not normally the person who touts statistics and data as the solution to things. I will say this community has taught me that data is going to get us a lot further as a state in tackling some of these issues. Public health and safety is huge. It is unorthodox to put public health and safety in a homelessness plan, particularly from the lens of encampment abatement, but that's what our community is asking for. And in order to have made this a community plan, we need to understand that average citizens are also impacted by this just as our vulnerable are impacted by homelessness. So you'll notice if you have a chance to read the plan, it's available on our website and the municipality's website, that the municipality is really defining some clear goals for public health and safety, and we're really broadening that to not just be about property owners or folks that are utilizing our public spaces, but also recognizing in the community dialogue that our vulnerable who are also those experiencing homelessness are being preyed upon in the same, if not greater capacity as our general public. I'll share that I had some fascinating conversations, it is anecdotal, with STAR, which is our sexual abuse advocacy organization, and Victims for Justice, which deals with non-sexual violent crime. And they're reporting a drastic increase in the number, particularly of women who are experiencing homelessness, who come forward and are being the victim of violent crime. What's really fascinating is those women, again, it's anecdotal, are reporting that it's someone in a car who drives to the location where they are being vulnerably housed and assaults them in that space and then gets in a car and leaves. And so the community mythology of our homeless individuals or those experiencing homelessness preying upon the public and one another, I think everyone in this room knows is not the full story. It may not even be the majority side of the story. And so when we talk about public health and safety and data, those are the type of myths that we need to bust, not only for community dialogue, but to be able to better cater interventions and keep our folks safe. And last but not least, we're really encouraging private and public partnership. There was a really lovely press release a couple months ago, but the mayor, in conjunction with a number of our private and foundational entities in the community, have organized a homelessness leadership council. Some of you are more versed in that than others. But the idea behind this is twofold, and one is accountability. So holding the folks that are a part of this plan accountable to the things that we've committed to doing, and really looking at that on a regular basis. And the secondary piece to that is looking at it from an advocacy and fundraising perspective. We have very successful fundraisers in our provider community, and they do a wonderful job advocating for their clients. That doesn't mean that systemically that's the place all the funds should go. And so we need to have an entity that can look at this more broadly and holistically and really see what the big picture is for Anchorage. I think what that means for the next year, which is oftentimes more exciting than a plan that hopefully will just be a guide for the work in the coming 3 years, is what we're actually doing. And as I mentioned, I think the approach must be twofold. We have to look at capacity increases. We know that there is not enough housing for the folks who need housing in Anchorage. And we know that Anchorage doesn't operate in a vacuum. Like all of our urban areas and like our rural hubs, the interplay between rural and urban homelessness is nothing that's going to come to anyone in this room as a surprise. So from a capacity perspective, we have several things that are already in motion that will be operationalized or expanded in the coming year. I think folks have heard about our 2 rapid rehousing efforts in the community. So in partnership with the Providence Foundation, United Way, Catholic Social Services, and others have increased our capacity to do rapid rehousing for families by about 50 families at a time in this current phase. Widener Properties, Cook Inlet Housing Authority, Catholic Social Services have created a slightly different partnership, which is a pilot, which has also expanded about 40 to 50 rapid rehousing beds for particularly our families, though their inclusion criteria is a bit more broad. In addition to that, we talked about this briefly this morning, but Anchorage was very fortunate to be able to participate in 2 pretty significant federal level demonstration projects. One is the Youth Homelessness Demonstration Project. You've probably heard about this in years past, but the finances of that have actually pulled through in the last 30 days. And so we're looking to start operations. People are hiring right now, so we're hoping to start operations quickly. But that is going to add, as you can see, approximately, 8 finite permanent supportive housing beds. However, Volunteers of America, who's running the permanent supportive housing for young people, has actually increased their funding ask and is hoping to serve about 20 youth and young adults. And they're doing that sort of with expanded funding. We're piloting a host home project through Choosing Our Roots, which is being assisted by NeighborWorks Alaska, which is hoping to find host homes for our LGBTQ youth who we know are highly vulnerable, particularly to things like sexual trafficking or ongoing street homelessness. Covenant House, of course, who continues to be a staple in this work, is expanding their service array with permanency navigators to be able to help young people shepherd through the system. As we know, many of them are very disenfranchised. We saw the data earlier today that a lot of our young people are failures of our foster care system. And then Covenant House is actually expanding rapid rehousing for young people. And as you can imagine, I was not a good renter at the age of 18. Arguably, I was not a good renter at the age of 24. So our young people in rapid rehousing often need a higher level of support than our family units and our older folks. And I think what's really exciting is Anchorage has a lot of pockets of excellence like the rest of the state. So there are some really novel program innovations for our community that we're looking at critically to see how to expand those things. I mentioned this morning, but Brother Francis, our largest shelter in town, has been expanding or evaluating a medical respite pilot. And their initial data from the pilot is telling us that by having a medical respite unit within the shelter itself, 80% of the folks that were in that pilot have gone on to housing and have not returned to homelessness as of yet. And again, we need to look at that data in a larger pool and look at the sort of methodology to see how we can expand that. There's a number of other things I could rattle off, but Brian's a good timekeeper. I think the other piece, though, that I do want to hit on, because you've heard the capacity need from everyone who spoke before me, but I think it's important that, particularly for Balance of State and Anchorage as 2 COCs in coordination, that Brian and I are really looking at system-level improvement. So how do we communicate better with the public? How are we telling them the true story about the many faces of homelessness? I'll say that the level of ignorance and racism I experience when people talk about those people from the villages coming to Anchorage, it's ridiculous, and we need to have a better narrative for the community, and that is a joint effort. Having a better media plan and a better set of communications around homelessness in our state is a joint effort. It cannot be done in a silo. So Brian and I have been in talks about that. We're also talking a lot about data. You've heard me say that about 52 times now, but really looking at our HMIS system and what is our strategy for utilization of that system for the next several years. We have grown to a place where we can evolve that system, and whether it's client level data, provider level data, or systemic quality data. We can use the system for more than we're currently utilizing it for, but we need to build that vision and those capabilities. In Anchorage, we've been operating coordinated entry since 2017. We rolled it out like much of the rest of the country and have learned a lot of lessons from that. So we are very aggressively looking at doing iteration 2 of coordinated entry. And as a number of other folks have mentioned, ideally, especially in Alaska, coordinated entry should be statewide because we really are talking about the same clients. That has a lot of levels of complexity. So that is something that we'll be looking at in the coming year. And then I think for me, the cold weather overflow, you guys have heard that in Alaska in particular, it is a challenge for all of our communities to effectively house people in the coldest months of the year. I grew up in California. Nobody told me that we have 10 months of winter before I moved here. As a side note. I will say as a note of pride, one thing that I'm incredibly proud of that we've established in Anchorage is a consumer advocacy council. So empowering the voices of those who are experiencing homelessness and actually gathering people together who have lived experiences or are currently living in homelessness and asking them to advise Anchored Home, to advise the work our coalition is doing, to advise our program innovations. And that's really building on the momentum of our partnership with Covenant House around the Youth Task Force, but having a slightly different group for adults. And then I am open for questions if anybody would like to ask me anything.
Okay, thank you, Jasmine. Do we have any questions for Jasmine? All right, thank you very much. Really appreciate your work. We're happy to have you in Anchorage.
Thanks.
And batting cleanup today,
Hey, cleanup guy.
Brian Wilson.
Thank you, everybody. My name is Brian Wilson. I'm the Executive Director of the Alaska Coalition on Housing and Homelessness. I really like this going last thing because like all the communities before me are sort of giving my report already, so I will be brief, especially since folks had to bear with me for about an hour and a half this morning. I'm sorry. I apologize every year for that. So, first of all, I want to say it's really great to see an expanded Governor's Council. We're really appreciative to have a new seat on the Governor's Council, having Scott there, as well as the additional seats that were added. It's really good to have more voices at the table at all times, and so I'm looking forward to the dialogue that comes out of that. For us, sometimes I get the question, you know, what do you guys do as a coalition? And we do a lot of different things, you know, administer COC grants, we administer with the Anchorage Coalition, the HMIS database, and our partners ICA. But really, I really see a lot of our role is identifying and working with communities to figure out what's going on with housing and homelessness issues, and then trying our best to create matching strategies and find resources to combat that. We don't sit on a pile of gold. We don't have, you know, money to solve everyone's answers. Nor does any individual member at this table, but a lot of what we do is listen. We learn about the unique challenges throughout our state, and we do our best to find solutions or technical assistance for that. This is a slide that all of us have probably seen me put up before. It's what I put up anytime I present outside of our state to show that, you know, up here we have to take a different kind of approach. Our geographic area for our coalition is everywhere outside of Anchorage, which for most COCs, their eyes kind of pop out when they see that we're standing up a coordinated entry system that could refer someone 1,500 miles away to their closest resource. So, you know, when we go out and look for technical assistance for some of our issues, sometimes it's hard to find because we're sort of doing things to this scale for the first time that it's been done. It is a challenging thing, but we have had a really great year this year in terms of our advocacy and raising awareness to folks outside of this state. We have built really strong partnerships with not only our HUD regional field office, Region X office, and but also the United States Interagency Council on Homelessness. As I was mentioning this morning, we were invited to present at the USICH meeting in June in Washington, D.C. Myself and Chris Collerock from the Bering Straits Regional Housing were able to go talk to them for about a half hour to 19 different federal departments at once about the uniqueness of Alaska. And boy, did we see a lot of eyes open up when we kind of rolled out just basic information and the challenges that we see. A lot of folks aren't really aware that our transportation system is extremely limited and that folks are sometimes 2 flights away from the nearest emergency shelter. So that was a really great opportunity. And we've had some really good success talking to our federal delegation as well. We're in conversations with Lisa Murkowski's office right now about trying to find a way to add additional dollars to combat overcrowding situations in Alaska as well. So in terms of overcrowding, this is a slide that I steal all the time from HFC's housing assessment report, but it really shows the scale of the issues that we have in our state. This is showing percentage of overcrowded homes by ANSCA region. On the very bottom there, that is the national averages down there. And all the bars on top are the different regions throughout the state. And as you can see in the Callista region, we're showing extremely high levels of severely and overcrowded houses. But one of the things that we talk a lot about is, what does overcrowding mean? And we heard it in Lisa Murkowski's message this morning. Brian mentioned it earlier, and some of our partners throughout the state have mentioned that when we're talking about homelessness, a lot of times overcrowded situations isn't included in that by federal definition. A lot of times when we're doing our point-in-time count and having to send up numbers on an annual basis, a lot of our communities are sending up 0 numbers because the weather is so cold, the count's happening in January, and the houses may have 750 square feet and 12 people in them, but we can't count that as a homeless individual. And so it's really challenging for us to make the case that Alaska really is unique, and we do have issues, sometimes to a larger scale than every other place in the country. So some great news on that front. With these kind of connections and conversations we've been having, we're actually part of a rural balanced estate group that has 15 balanced estate continuum of care organizations in it that meets on a regular basis with HUD staff. Norm Sukar is usually on the line, William Snow. This is not necessarily a unique problem to Alaska, the overcrowding in rural areas. To scale it is, but they've been listening and are actually now considering ways to not change the homeless definition, but look at ways where they can identify or change what it means to be sheltered. Because if you go into a lot of our villages, they may not have an emergency shelter, but each home is acting in and of itself as an emergency shelter, because if those individuals were to spend the night outside, they would likely have severe complications with that. So I'm really excited about potential progress on that front. I'm really also excited about our progress in data. While the point in time count and the way that we define homelessness can have complications and not tell the full story, our ability to tell the story where there are actual resources throughout our state has dramatically improved. This is a screen cap from the latest, this from the 2017 HMIS annual report that ICA put together. And this is showing the total amount of emergency shelter by location. So in Anchorage, we're seeing these huge spikes, and these are individual individuals unduplicated by year. And really what this is showing, it's not showing that we had this huge increase from 2014 going forward. This is showing that we actually got our act together to measure it better. And this is kind of the first time, probably the last 2 years is the first time that I've said, wow, I feel really confident in our data going forward. That we can and we can really rely on it, and we try as an organization to put as many tools in the hands of advocates and stakeholders as possible. So if you go to our website, click on Learn More, all of our data is transparent and linked in there. And so as Jasmine mentioned, we're working towards finding a way to create one message, so it's not always just Balance of State and Anchorage. We have a lot of shared clients throughout there, but what we have up right now is also really solid. So coordinated entry, we've done a lot of talking about coordinated entry this last year. The State Coalition Board adopted its first set of policies and procedures for coordinated entry on January 22nd of this year, and we've kind of been on a roadshow ever since, going community to community, talking about what those policies mean for them locally, and figuring out a way how they can implement a coordinated entry system locally. And that's a huge challenge. The board kind of created a 10,000-foot policies and procedures document, understanding that coordinated entry is going to look a lot different in Juneau as it does in Nome. Or in a community that maybe just has a domestic violence emergency shelter. You don't have this full service array to refer folks to. And so while this is coming online, there are some challenges that the local agencies and local communities are having to face to stand it up. But the challenge that we anticipate as a board is that this is gonna do a lot in terms of being able to understand our clients that we're working with, having uniformed assessments that measures disabilities, barriers to housing, their income levels and whatnot. That's going to be great, but the level of resources we have to refer folks from our coordinated entry system into a housing unit remains extremely limited. Even in our communities such as Juneau, which we heard a lot about, the Forget-Me-Not Manor at lunch, or Fairbanks, which has TCC, which has permanent supportive housing units, the rate of referral there is extremely slow. It could sometimes be months before one spot opens up. And so we're going to create this big list and not a whole lot of ability to put people into a place. And so you've heard me come up here a million times and say, we have this big gap. We need to drive forward with our permanent supportive housing plan that calls for 500 more units in X amount of years. But again, I just have to reiterate, our COC has a total of $800,000 in our COC grant program. We had to turn down 4 applications from communities who are ready to go with programs that have done the work to measure, that have created models that are following best practices, and we don't have much resource to put out there. It's awesome to see HFC create funding that is specifying money for rural, but gaps do still exist in funding, specifically around operating costs. And I was having a conversation with Brenda earlier that it's important not to get the cart before the horse. That we need to make sure that those behavioral and case management supports are in place before we're just putting, highly vulnerable individuals into a unit. That is not setting them up for success whatsoever. So I'll just end on kind of how we've always ended it, that in 2016 we had a Governor's Housing Summit and a group that included probably 100 or so folks from around the state focusing on the topic of Alaskans experiencing homelessness. There were 9 recommendations that came out of it, and really just the 3 that we want to highlight here, and hoping to see the Governor's Council continue to push towards is the need for that high-level coordination and policy alignment across housing and homelessness issues throughout the state. We have a plan that was adopted by this board for permanent supportive housing at the last year's meeting, so 2 meetings ago, which is great. It has an outline in there, so I highly encourage that we focus conversations around those work items. And really finding ways to coordinate funding for housing and for housing services across the state. We've been throughout the state linked by clients more than we've been linked by organizations and funding. So it's important to find ways to make it easier on our communities that have limited resources to be able to fund these types of programs that involved both housing dollars and support services on the wraparound supports as well. And then increased dialogue and awareness of issues with the legislature. So, we're very limited as a coalition in our role in advocacy. There's a lot of limitations in what we can say, but this council here serves as an advisory board to the governors. So while I may not be specifically advocating about something, we do a lot of educating. And when people say, how do we solve this? What is different about Alaska? It's education to say that we are one of 3 states without a housing trust fund, that many other states utilize to help fund affordable housing and homelessness projects. And I also educate that, we always say, the programs that we have to address affordable housing are very successful. Not just the permanent supportive housing programs that were talked about at lunch, but the host of HFC's supportive housing programs that they have. It's I definitely incentivize folks to say that, investments or even reinvestments in programs that are making money for the state is not necessarily a unique idea that Alaska would have bred. So, other than that, that's all I'm going to kind of leave you with today. But if you have questions, I'd be more than happy to answer. But I really do appreciate you guys giving the time for each of the communities to come up and speak about their situation.
Thanks, Brian.
Yeah.
Do we have any questions for Brian? All right.
Are you still the only staff person?
For the moment, yes. Although we are getting ready to sign a contract, we did secure trust funding to bring on a rural planner for our organization, which is going to be huge. It will make me travel less, which is awesome. But it'll also provide a lot of additional technical support, technical assistance supports for our rural communities in developing housing strategies.
Good.
Mm-hmm.
Do we have any other questions? All right, thank you very much, Brian.
Thank you very much.
Would we like to take a 5-minute break? Okay, that's okay. Why don't we do that? Try to keep it brief because we still have quite an agenda, but let's take a 5-minute break. Stretch your legs. Jennifer Moreau has called in and is on the line, as well as Jason Hahn. Welcome, Jennifer, and for both of you, if you have a question, when we get to the question part of things, just go ahead and speak up and we'll recognize you at that time. First of all, before we move down the agenda to Jennifer on an update on Alaska's plan to end long-term homelessness, I'd like to ask Scott Shambor to say a few words kind of summing up the coalition updates, because he gathered kind of a total in a few different areas that I think would be of interest to folks.
Yes, thank you very much. I think on the break, it kind of struck me that you can see some trends in the presentations from the coalitions that have come here today. And coming from the local coalition angle, I speak the language and I can see those trends, and wanted to make sure that it was very clear for the council as well. One of the big things that you heard today is that there's an increase in cold weather emergency shelters being developed. Now it's up to like 7 communities. And so whereas that shows a community commitment, short-term resource for public health and safety, it also speaks to some larger policy issues, because we know that emergency shelters, especially for a short period of time, don't typically have the supports and case management to get people into housing. So just recognizing that trend. Other pieces is that communities are really looking at, what is the natural outcome on the other side, is how to do more supported housing. And so we had Nome, Matsu, and even Anchorage looking at more housing first technical assistance needs and how to get funding to do more supported housing, because they're ready to go. So that's another policy feature. 2 communities are looking at rapid rehousing programs. Fairbanks has the assistance in place and getting ready to go. Juneau is interested, and I'm sure some smaller communities are as well. Encampments, again, a huge issue here in Anchorage, but that's cropping up in other parts around the state as well. We had that issue in Juneau about a year ago where it would really put some stress on local communities as to how to approach them. The ACT team, Assertive Community Treatment Team, was mentioned by a couple of communities, Juneau and Fairbanks, how to triage really those really complex individuals and get them housed. That is an expensive intervention, but obviously there's a need presented in both those communities to start taking a look at it. And then the final thing is all the other pieces are really about continuum of care development on the local level. Places like Matsu, Nome mentioned that they want to pursue 5 different pieces of their continuum of care because they recognize the need. So any way that we can, as a body or state agencies, help them facilitate those transitions or provide technical assistance and funding, I think is something for us to consider.
Yeah, and thank you, Scott. I really appreciate that. Your brain worked in summarizing it way better than mine did. So I felt kind of foolish when you listed through the whole thing, and I realized I hadn't put 2 and 2 together. But thank you very much. With that, I will hand it over to Jennifer for a very brief update on Alaska's plan.
Thank you. So I just wanted to let everybody know there are copies of the annual update for the 10-year plan. The 10-year plan was created in October of 2015, or adopted in October of 2015, and it's a framework to help local communities with their planning efforts to address homelessness. And the great thing about the updates, this will be our 3rd update for the plan, is that it's basically a collection of all of the updates that we received from the different coalitions. There's more than a dozen communities, and their efforts are included in the update. And for when 6 months from now, or you're trying to remember who did what in what community, you can go in there and look. If you're a member of if you're somebody who's interested in addressing homelessness, the updates have who's doing what and where, so you can find out, oh, Love Inc. on the peninsula is doing this amazing thing. I'm going to reach out to them and ask them for help in starting something like that in my community. And Mike was generous enough to let me tell one Fairbanks story that I thought was really great because it illustrates like the levels of community activities that are included in the plan, and it involves Angels in Motion, which was started by 2 community volunteers named Billy Castle and Leona McDaniels, and if I get any of this wrong, jump in, okay? But it was really great. They just started doing street outreach in downtown Fairbanks and handing out sandwiches, and from that has grown this grassroots movement for street outreach, which is one of those really vital services in homelessness that is not always well funded and not always available. But this community saw a need and started to fill that need. And it's grown into where they have private businesses that support it through food donations from a local pizza company, local community schools. The kids make sandwiches for the handouts and the outreach, and that's a really exciting small community response thing that really can make a massive impact in connecting people with services. And with that, I will just go ahead and say that there's even more stories and wonderful things in the update that you can read online at the AHFC website under the statewide homeless housing link.
Thanks, Jennifer. Do we have any questions for Jennifer? All right, thank you. Also today, we are fortunate enough to have somebody visiting us from the United States Interagency Council on the Homeless. She's been with us once before and always brings interesting information. She has a much broader national perspective than we get here in Alaska, so I'd like to introduce Katie Miller. Welcome.
Thank you so much. So again, I'm Katie Miller from the U.S. Interagency Council on Homelessness. I'm sorry to have my back to everybody, but I'm thrilled to be here. And I've had the opportunity to be in Alaska 3 times this year, and each of my visits have been very powerful. So I'll talk a little bit about that more in a minute. But I wanted to come back at this meeting and give you an update since our last meeting on things that we've been working on at the federal level. So for those of you not familiar with the U.S. Interagency Council on Homelessness, we are a very small federal agency, but we coordinate the federal response to homelessness. So we are responsible for coordinating 19 federal agencies at the cabinet level, at in Washington, D.C. And I am based in Seattle, Washington. I'm one of 5 people that is not living in Washington, D.C., and I work with communities. I work from the Dakotas to Hawaii, up here in Alaska, down as far as Nevada, working with communities to bridge what's happening at the local level with what's happening in Washington, D.C. at the policy level with our 19 federal partners. And so some of the exciting work that I want to share with you today, I want to specifically talk about the federal plan to prevent and end homelessness. So we, in July, released a new federal plan. So for many years, we were operating under our first ever federal plan, which was called Opening Doors. And we did a tremendous amount of work under Opening Doors, but now we've released a new plan called Home Together. And I gave you all a copy. And for those, we have other copies over here on the table. So grab one. I'm hoping to not carry them back in the airplane. So please grab one. We're excited about this plan. It is based on a lot of, the changes really are based on a lot of feedback that we've received from many, many stakeholders. And it really is based on the feedback we've gotten, but what we know has worked, and then where we feel like we fell short in the first plan. So first of all, the title. We spent a lot of time thinking about the title. Home Together, and we obsess over that. A lot of communities, a lot of states have taken all of the good titles of plans, and so we spent some time on this, but this one, home, really is the solution to homelessness. So a home is the platform for which people can stabilize their lives. It's where they can become healthy. It's where they can pursue opportunity, and that's how we end homelessness. So home is the solution to homelessness. Together, because it takes all of us working together to end homelessness. It is going to take the state, the federal government, and local programs to be well coordinated to end homelessness, and all of us must play our part in ending homelessness. So the key pieces that we've felt like we're missing in the first plan, where you're going to see a lot more emphasis in this plan, are in areas of affordable housing, which isn't a surprise. That's a lot of what we discussed here today is the need for more housing. Prevention and diversion. We have not talked a lot about prevention and diversion previously. Unsheltered homelessness, especially in the western part of the United States, we're seeing increased numbers of people living unsheltered, and we are working very strong with our other federal partners to look at solutions to unsheltered homelessness. Strategies for rural communities. Economic opportunity, really connecting jobs to people who are experiencing homelessness, and learning from people with lived experience. The plan requires strategic focus, effort, and investments from both the public sector and the private sector, so we acknowledge that. The structure of the plan is grounded in a shared vision. So all 19 federal agencies have signed off on this plan, and the shared vision is this. This is the definition that was brought up earlier. What does it mean to end homelessness? To end homelessness, every community needs to implement a systemic response that ensures that homelessness is prevented whenever possible, or if it cannot be prevented, it is a rare, brief, and one-time experience. The plan is also rooted in our federal criteria and benchmarks that was mentioned earlier. For those communities that have ended veteran homelessness, they use the federal criteria and benchmarks for ending veteran homelessness. This is really a roadmap for how communities create a system that makes homelessness rare, brief, and one time. So these criteria and benchmarks, these metrics have been created now for all populations. And so we've done that. They are the qualitative and the quantitative benchmarks that provide that roadmap in assessing how these systems are designed and how they're implemented, and it helps them measure and track how far they are from reaching the goal. So again, we're excited about that work. Here in Anchorage, the youth criteria and benchmarks are in the process of being piloted here, and so we're excited that Anchorage is going to be a part of helping us test these benchmarks and criteria on youth homelessness to understand what works, what doesn't work, and whether we need to make any shifts in that. So housing first and the focus on permanent housing underpins all of the plan. So when you read this plan, not only is it shorter, it's easier to read than the previous plan, it's very clear that permanent housing is what we're focused on. The plan continues to offer specific strategies for subpopulations, so you'll see that veterans, chronic homelessness, families with children, unaccompanied youth, and all other individuals are in the plan, and they have specific strategies. What's different in this plan is that we don't set specific years. I think if you're familiar with our previous plan, we said we'd end homelessness by 2020, we'd end chronic homelessness by a certain date. We don't do that, and we heard that feedback from communities that every community is unique and different, and that we need to work with communities on what's happening locally so that you can set aggressive targets that are unique to what you have going on in your community. And so we will be doing that. So the dates are no longer in the plan. But we do encourage communities to set ambitious goals and really to work towards those goals. We still have many communities that are lined up to end veteran homelessness. We had another community come forward today. So we've had 64 communities in the country who have effectively ended veteran homelessness. So they've created that system that has made homelessness rare, brief, and one time for veterans. We want to call out, I want to talk a little bit about the specific work in the plan around rural homelessness, because that's been a big focus of the conversation today. In the plan, we really want to strengthen the capacity in rural and suburban areas to maximize outreach efforts tailored to the unique challenges posed by geography and population distribution. The federal partners are committed to develop guidance and tools to support rural communities to build partnerships and efficient systems to identify and engage all individuals and families experiencing homelessness. We're going to support rural areas to implement effective regionally specific coordinated entry processes. We heard a lot about that in the reports, that is challenging, and we recognize that. We, recognizing the unique challenges posed by geography and population distribution in these areas, the federal partners will offer technical assistance and tools to support communities in strengthening their coordinated entry processes and ensuring that they are fully accessible. The plan also establishes the need to address the racial inequities and other disparities in the risks for and the experiences of homelessness, and to improve access to emergency assistance, housing, and supports for historically underserved and underrepresented or overrepresented groups. So we're doing a lot of work and look at issues of racial disparity in the homeless system, and really helping communities measure the outcomes of those folks that are overrepresented in the homeless population. In our work with USICH and HUD, we've been convening an interagency working group on ending homelessness in rural communities since February of 2018. This group has focused on 4 key strategy areas. We develop and provide coordinated TA, so improve the data collection on homelessness in rural areas and increase the knowledge and capacity of rural communities and homeless service and housing providers to improve access to housing and services, ensure that federal strategies and actions to end homelessness in rural areas are informed by consultation and engagement with rural communities, and then evaluate awareness of homelessness and housing instability in rural communities to implement best practices for preventing and ending homelessness. We also provide guidance and program support to further capacity of rural communities. At the last meeting here in May, or at our last meeting in May, I had just returned from Savunga and Nome, and I had the opportunity, I think the gal from Nome stepped out, but we had a meeting in the winter shelter space, and it was very cold. It was very wet and very cold, and the winter shelter was not operational at that time when we were meeting in that space, and it was a lovely space, but as we left the building, we walked out to the beach where people were starting to congregate for the night, and where they were going to begin bedding down for the night. And it struck me that how awful it is that people are having to sleep outside in those conditions. And so that was a very powerful visit. It was very powerful for me to go to Savunga. And as a mother of 3 children, in the middle of the day at 11 o'clock, to see children lining the floors of homes because they have to sleep in shifts to be able to get rest, and that they weren't in school because they were so tired. And so that was hard to see. And then I was also able to come back to Alaska in August and go to Dillingham, to Bristol Bay, and meet with tribal leaders, and then also to Juneau, and actually got to see the Forget-Me-Not Manor in person. I love that building. It's really impressive. So I'm really impressed by the work you're doing here, but I'm also aware of the significant challenges that you have, the issues of overcrowding and housing conditions that are very, very poor. The incredible cost of housing is striking to me, and the cost of supplies, the ability to actually to work on housing, to even bring it up to code is extremely expensive. So we had, as Brian mentioned, we were able to bring Chris Kollarak and Brian Wilson to Washington, D.C. this summer, and they did speak to the council, and the council was so moved by their presentation. And so the brief that they presented, I sent out to you all. If you haven't seen it, it's also on our website. We sent it out in our national newsletter. And the recommendations that they presented have been reviewed by the Interagency Working Group on Rural Homelessness, and they're being incorporated into our federal work plan. So I wanted you to know sort of the feedback loop of that work is that we are hearing you, and we are bringing that into our work the best that we can. Our Interagency Working Group on Rural Homelessness has also released a resource since I saw you last. It's called Strengthening Systems for Ending Rural Homelessness, Promising Practices and Considerations. A lot of that came from a forum that we had in Boise, Idaho last year. We've just done another forum with states around the country on rural homelessness in Jackson, Mississippi last month. HUD has also released their Balance of State Toolkit, which highlights unique challenges and solutions in rural areas and federal and local resources to support rural areas. HHS, HUD, and USDA convened their annual health and housing staff meeting, and that was specifically focused on rural homelessness. So we're looking for opportunities to align messaging and communications across our federal and national partners, and we will be developing a resource that summarizes the federal resources available to rural communities that can support the local efforts to end homelessness. We realize that that's part of the capacity challenge, is understanding how to braid these resources and what federal resources are really available to leverage with the local dollars. And so we're going to be working on that resource for you. I also want to talk about the work we're doing on tribal homelessness. In November of 2015, AKCH and 7 other federal agencies signed an MOU to implement strategies to set a path to end homelessness among American Indian and Native Alaskan populations. In March of 2016, we developed a specific action plan. The working group is setting a path to end homelessness among American Indian, Native Alaskan populations. We have 4 strategic focus areas. We're going to work on improving access to housing and services through administrative action, where possible, and provide guidance and technical assistance, improve data collection on homelessness among Native Americans both on and off tribal lands to better enumerate the size and scope of the problem. And we want to ensure that federal strategies and actions are informed by consultation and engagement with tribal leaders, urban Native communities, and experts in the field. We'll also be elevating awareness of the crisis of homelessness and housing instability among Native Americans, both on and off tribal lands. Recently, I hope you heard about a new technical assistance opportunity that HUD SNAP's office put out around addressing homelessness in tribal areas. And this is about better connecting resources and to those homeless serving communities and connecting it with the tribes. And then we will continue to consult with the experts in the community, and so we're continuing to create pathways to do that. So again, thank you for having me. I'm thrilled to be here. I'm thrilled about the work that's happening in Alaska.
Thank you, Katie, and thank you very much for going with that group up to Savunga.
Yeah.
I know anytime we have cabinet secretaries or other federal officials that come up here, really for any of the challenges Alaska sees, if they only go to Anchorage and Juneau or the regional hubs even, they don't have a sense of the real issues that this state is dealing with. And the fact they went to Savunga allowed you to see firsthand what the true, most serious housing challenges are.
Yeah. I have Brian Wilson to thank for that. He made that trip happen, and his board members who took us into the community that welcomed us and spent time with us, that we would not have had that opportunity without that.
That's great. That's great. Any questions for Katie?
I don't have a question, but I would like to say thank you for bringing Brian to DC to present to the Interagency Council. That, like you said, it brings the loop around and for them to actually hear from Alaskans. And thanks for that. That was pretty fantastic.
Thank you. Good.
Okay, thank you.
Thank you very much.
Next on the agenda is Dr. Richard Monsager. Dr. Monsager has recently come on board at the Rasmussen Foundation, where he has been tasked with working on homelessness issues. We were fortunate enough to have Dr. go with us to a 2-day trip to Minnesota to witness and view and dig into some of the homeless programs and ways they have with dealing with things there, much of which we could learn from. And so anyway, without further ado, Dr. Monsager.
Thank you, Brian. I'm Dick Monsager. For those of you who don't know me, I spent 30 seconds about who am I. I'm a pediatrician by background. I made a migration, was a young guy, into hospital administration, so I spent most of my life in hospital administration. Thought I retired last spring, and then as of the end of July, got called into another challenge to say, can I add any value? So that's the open question, whether I can add any value in the discussion around significant changes in the status quo around homelessness. So I'm 90 days on the job. So how did I and why did I get interested in homelessness issues? It really got triggered as kind of a emerging theme and late in my hospital career, but was crystallized about 6 years ago from a doc in Spokane, an ED doc at the big hospital in Spokane, who made a comment that I have plagiarized freely and have used relentlessly ever since. And he made this statement that in his view as an ER doc, housing is the first and most important prescription. It's more important than meds, it's more important than hospitalization, it's more important than surgery. It's housing. Well, as the years have gone by, I've become more and more a believer that he's absolutely correct. So the chance to say, work with Rasmussen Foundation now for a few years is say, can we positively destabilize and incentivize some other change was a captivating challenge. So here I am. So Rasmussen Foundation, as those of us here in Alaska know, its mission is to promote a better life for Alaskans. The program areas of interest have historically been arts and culture, health, social services, housing, and promotion of philanthropy. So for those of you not from Alaska, it's a reasonably big foundation. It's the biggest one in Alaska, and makes an annual investment of several tens of millions of dollars into our state, across the state. And their board last summer said, we want to see if we can make a sizable investment into housing issues and make a difference. And initially we will focus on Anchorage. So the initial focus for Rasmussen board is in Anchorage, but it's really clear to me that true to their mission is that the whole state of Alaska is the interest. So my role is, when I was talking, my kids were talking to me when I said, it looks like I'm not going to stay retired. And of course they said, Dad, you failed retirement. And I said, well, yeah, I turned it into a sabbatical. But, so what's the job? And initially I said, well, I think the job is to go do good. Well, that's not a very good job description. It's, I have no staff, I have no program. So this is a job of influence and bridge building, as I see it. And, but the roles are coming more into clarity. Advocacy being one. So for right now, I've been mostly listening, but I suspect I will now start being more in this public sphere with saying some of the things that I think have opportunity for change. Financing, and in the short term, I'm really confident that in the very near term, you're going to hear about Rasmussen's board making some reasonably sizable investments, as I said initially, in Anchorage. I think that will happen in just a few weeks. And try and incentivize change. Where Jasmine talked about data is really weak. That's been a recurring theme, I would say, to one of your comments, Scott, is that's a theme in all of our communities, is data is really weak. It's really tough to talk to in Anchorage's case, the assembly, or to the public about how many people are homeless at any moment in time, what's the monthly inflow, what's the monthly outflow, where do they go, what subpopulations are. We use point-in-time data. I would argue that for improvement, point-in-time data once a year is not good enough, that we need data on a much more regular basis if we want to really say whether this is just a change from year to year or whether this really is a statistically valid change. So I think that'll be an investment. I think that we will continue investments in some of the pilots that Jasmine talked about, Path to Independence, rapid rehousing of families, the Pay for Success initiative that HUD is funding here in Anchorage needs now initial investment. I'm pretty confident Rasmussen's going to make a sizable investment. We hope Mental Health Trust will be another significant funder in that in the near term here in early 19. And then can we work with funders to more align for results that are needed rather than every entity asking funders independently? Is that possible? To some extent. One of the things as a pediatrician by background that I was really captivated by in Minnesota is that their private philanthropy funders have coalesced around the theme of homework begins at home. I think that's a pretty profound statement if you think about families and kids and that without a stable home, the chance for all kinds of reasons, homework and school success is pretty unlikely. But philanthropy is only going to be able to go so far. Public policy has to change too if we really envision change. As I learn more and more, we talk about the folks that have the highest vulnerability on the VSPDAT. Without the support part of permanent supportive housing, being successful on the capital side to build projects or buy projects or have units be disability accessible isn't going to make a big difference. And public policy, to me, seems to be woefully weak on being willing to fund the support. If we can coalesce around that in the years to come, it's going to be a full court press to convince funders, government, that that's an investment that will be good for the individual and will be good for the communities. I think we were all intrigued in Minnesota. To some extent, they have addressed it just flat out. They have a certain amount of GF funding that pays a certain amount per client per month to help make the support side more possible. We don't really do that in Alaska. I don't know if that's the right solution, but I really am convinced that unless we can figure out a way beyond pilot projects for the support side of permanent supportive housing, it's going to remain an elusive goal. What else do I want to say? I'm really intrigued, and I think there is an opportunity right now that we can demonstrate change, and then I'm going to be optimistic that policymakers and the public will respond to data. If we can show that we can move people out of housing and they stay housed in a better way than we've been able to tell the story, that can generate more investment. You know, one of the stories I perceive has been very under talked about has been the success the VA has had the last 8-9 years of vets being housed. The numbers I've seen from 2010 and here in Alaska compared to now, it's a small fraction that are unhoused today compared to 2010. We don't talk about successes very much. We talk about all of our problems. But I think we should say, what can we learn from the VA? What is the support systems they've got? Is that the model we should follow to some extent? But let's also tell the story that there's been some successes too. So with that, I'll stop.
Okay. All right, thank you, Doctor. Do we have any questions for Dr. Monsager?
I look forward to getting to know you all better.
Yeah, and we really look forward to, one thing we heard from in Minnesota was it was kind of all hands on, it's common sense, I guess, but it's kind of all hands on deck. Federal agencies, state agencies, local agencies, nonprofits, private individuals, philanthropic foundations, and you play a valuable role in all this, so thank you.
Can I make one more comment?
Yep.
Because I think it's not just foundations, I think it's businesses too.
Yep.
The Path to Independence project here in Anchorage, there's a whole bunch of businesses are investing in this. And so we have to look at that as a funding stream too in a way that we haven't ordinarily done it too.
Yep, agreed, thanks. All right, next we will move on to our state agency updates. We have 4 of them. We'll start out with the Alaska Housing Finance Corporation. Our planning director, Daniel Delfino, and public housing director, Kathy Stone.
Good afternoon. Thank you. I'm Kathy Stone. I'm the director of the Public Housing Division, and in your packets, I believe there was a report, kind of a joint report between Public Housing and Planning. I am not going to read the report because I know you all can look it over. I'm just going to provide some highlights from that. At the beginning of the report is a table. It's a sampling of communities, and it describes the income levels that you need in order to be eligible for our programs. And so just to let you know, to be eligible for the voucher program, you need to be at or below 80% of area median income. And for our public housing program, I'm sorry, the opposite. You need to be at or below 80% for our public housing program and 50% for our voucher program. And the reason this is important with respect to our overall programs and homelessness is on the second page, it shows the distribution of all of our programs by average income. And currently, for all of our programs that we run in public housing, 75% of our participants are at or below 30% of area median income, which HUD defines as extremely low income. So that means you make in Anchorage less than around $20,000 a year. In Bethel, that would be less than $18,000 a year, and so on down the table. It shows what you can make for your income or below to be eligible. So we continue to assist those families that are very much on the edge of homelessness in our programs overall, which I think is a pretty profound demographic. Also, we each night we assist about 15,000 people through our programs between our voucher program and our public housing program. So even though there's only a little over 5,000 vouchers statewide and 1,600 public housing units, that represents, the 15,000 is the families. So there's a lot of children in there and elderly living together with families. So 15,000 total each night. With respect to a couple highlights from our programs that directly assist homeless persons, I want to point out that we applied for and received recently from HUD something called mainstream vouchers. We received 50 just recently. This is a partnership with DHSS, Division of Behavioral Health, and the target group that this is going to serve is non-elderly disabled persons that are either homeless or coming out of homelessness or institutionalized or coming out of institutions. So we will be working with DHSS Division of Behavioral Health to identify that VI SPDAT list, and they will be identifying the top on that list, and then it's essentially a tenant-based voucher. So they'll identify the next person on the list and refer them to whatever voucher location is in their area so they can get voucher assistance directly. So that was a recent good thing that we got just this past summer, and we expect to roll those out within the next month. We're finalizing our agreement with DHSS and getting that out on the street. Another recent increase that we're pleased with is we received another 25 Veterans Affairs Supportive Housing, also known as VASH vouchers. We are now up to 306 VASH total within the state. That's a really good number, and I think HUD continues to recognize that we utilize these to a great extent, and they are serving veterans throughout the state, and so we continue to get more. So that's great news. We just got additional 25, so now we're at 306. I am happy to take any questions anyone has on any of these set-aside programs or our main voucher program, but it's been a long afternoon, and I'm going to turn it over to Daniel.
Yeah, go ahead, Brenda.
Just one question, Kathy. I didn't catch, when your new voucher that's rolling out, who did you say who's going to refer them to the voucher place?
Sure. So, Brenda, you're asking about this mainstream, the mainstream voucher program. So, we've got 50 assigned to us from HUD through this program for funding, and it's going to be through Division of Behavioral Health. They have a list, a continuum of care list of people, and it'll be based on their VI SPDAT score, their vulnerability index scoring, and they'll identify the next on the list and refer them to us.
So when you say DBH, so if somebody's in a DBH institution, then the institution would be getting them over to get the voucher?
Yes, possibly. I think that's, we can have more of a discussion with DBH if you want, exactly how they're going to identify them. Yep. Any other questions?
Similar question on the same thing. So who will be doing the verification necessary for eligibility or eligibility determination for that?
I think the initial eligibility will be determined by DBH, and then it'll come into HFC to do, we do the income eligibility, whether or not they're eligible within our own regulations that we have. If they've already used our services, sometimes they can be screened out for some criminal behavior. This is similar to the Moving Home program. It's going to operate virtually identical to the Moving Home program we have right now with DBH, and so it's going to follow along those same lines. They do initial screening, they send them to us, we just do the eligibility, and then it moves into giving them the voucher and getting them out to
How
the
long would
community.
that take an average applicant? And I know there's no such thing as an average applicant, but it sounds a little cumbersome, and I hope you're going to tell me that I'm wrong.
I'm going to tell you that if they have good case management and that person is receiving the help they need to get through this situation, through the application process, our process takes anywhere from 4 to 6 hours, because there is, they have to go through a class, they have to take a briefing class, there's some paperwork they have to fill out. It doesn't take a long time from when we receive them at HFC. Within DBH's own process, I think they already have those persons identified on their list, and they will just make sure that they're attached to services and send them to us. That's my understanding.
So how long?
I'm not exactly sure how long DBH would take, but I can tell you for us it takes about 4 to 6 hours once they come into our office. But it's not always just one meeting. It's coming in, filling out some paperwork, taking a briefing class, and then going out into the community and shopping with the voucher.
So I'm trying to think in terms of calendar period.
Oh.
So you guys alert the world that there's a space available. A case manager says, aha, I have a good candidate for this, and they start walking somebody through this process.
From when they get the voucher to shop, it shouldn't be more than a week or two if they have their paperwork together and if they're ready. If they come into us ready from when they get their voucher, it shouldn't take long. It should be pretty quick.
We'll have DBH coming up after.
Mm-hmm. Okay, and I know we'll have DBH up here shortly. I can ask them the same questions, but I'm just trying to get a sense of how long it's going to take someone to move through 2 different agencies to get to then start shopping for a place.
And we've been doing this with that moving home program, and it's been very efficient, and the collaboration has been great, and the partnership, and it's really just a communication thing, and those leased up very quickly, and so we're thrilled to have 50 more, because we had 150 in the moving home program. They leased up quickly, and those folks are staying stabilized and housed, and so now we'll have 50 more to work through.
Thanks.
You're welcome.
And I'd also like to give kudos to you, Kathy, as well as the VA, because the way the veterans vouchers work is if there are states that are unable to utilize those, it goes back into a pool and gets distributed to the states that have been utilizing them and leasing them up. And it's only because we've been doing such a good job in our work with the VA leasing them up that we continually get more and more, which of course is of great benefit to Alaskan veterans.
Welcome. Thank you.
Okay, Daniel.
Okay. Hi, everyone. Sorry, first couple of words are always awkward at a mic. I'm Daniel Delfina. I'm the director of the planning department, and like Kathy, I prepared a handout for you in your packet that I'm not going to read verbatim or even close to that, but I did want to basically provide a reference for you in case you wanted to share it with any members that you work with or ask us any follow-up questions in a meeting. We'd be happy to take those. We manage in the planning department about 8 different programs. 7 of them are listed. There's an 8th one called the 811 program, which is fairly complicated. Roughly, these programs touch about 14,000 Alaskans on an annual basis. And rather than having folks try to understand each one of these programs individually, Jennifer staffs a statewide homeless housing office, so all people need to know is they can contact Jennifer and she can try and navigate them through those programs to try and understand which one is relevant to their agency or their community or their specific housing need. The programs that we manage, like I said, it's about 14,000 Alaskans every year. Most of these are nonprofit shelters or support service agencies focusing on a broad spectrum of need. A subset of these programs is something that we call the Special Needs Housing Grant Program, where there are about 300 Alaskans in actual dedicated facilities that are supported by these programs that are supported with 3-year operating grants. Our funding is stable. We make these on a long-term basis, so if there's a change in funding, there would be a long-term tail for these before they would be affected by any one-year legislative changes. So I just wanted to sort of communicate that to you. And then just to provide a broad overview, a lot of these programs, 75% of our funding is managed in partnership with the Trust. We have a very close relationship with Kelda Barstad and a lot of the other people that you're going to be hearing from, Morgan at Corrections and Susan over at DHSS. A lot of what we report at HFC is done with our other statewide partners. So I just want to briefly talk about that, and just there is a lot that's going on between the agencies behind the scenes to make the numbers that we're showing up on our letterhead possible. One of the things I did want to point out was last year at this time, the councils adopted a performance target for the supportive housing plan to try and develop a little over 400 units of supportive housing. We're a little over 3/4 of the way there with the units. We're over 300 now. Our Greater Opportunities for Affordable Living program, which generates about 160 to 200 units per year, about 30% of every unit, or 30% of all units that we fund under that program have been set aside for homeless or disabled Alaskans, and there are support services associated with those units. These are a broad spectrum of need that these units serve. They may not necessarily be supportive housing. These may be for overcrowded living conditions in rural Alaska. Unlike some of the federal programs, we don't use the definition that some of our federal partners do, where you have to have a community less than 25 or 30,000. Our definition is you have to be off the road system and have a population less than 6,500. So when we say rural, it's what means rural in Alaska, not according to a federal definition. So it's usually considerably more remote. We have 2 funding rounds that are open right now. Our main production driver, the GOAL program, our applications are due in November, so we're going to add to that total, and we'll have new supportive housing units that we're going to be able to report at the May meeting. And then we also have a special purpose round that's out now. It's in partnership with our Public Housing Division and our partners over at the Mental Health Trust and DHSS. It really is a collaborative effort, and I know in a lot of these meetings there are discussions about a funders collaborative. The resources that are being brought into this round would literally represent a funders collaborative in probably 5 different agencies in most other states. That because of our small state structure, we all know each other and we're able to form the partnerships to make this supportive housing round possible. We put out a little over $8 million in construction resources, and then $1.8 million in operating and support service funding, in addition to rental assistance provided through the Public Housing Division, and then the 811 rental assistance provided in partnership with HFC and DHSS. So we closed on that round. We did have interest, and we're going to be very excited to report to you the outcome of that round at our May meeting. So we took that goal seriously, and we're hoping to be able to get close, if not clear the 400 bar by the time that we talk to you next May.
Yeah, and we will know the results of that much earlier than the May meeting, but we will be discussing to the council the results of it in the May meeting.
Yeah. And then one point that I just did want to make in closing is that in that supportive housing round, there was a specific carve-out that I believe Brian alluded to earlier for rural Alaska, and this is literally for those rural communities that are off the road system or that have very small populations, where maybe they don't have coverage through HFC's Public Housing Division, or maybe they have a need that doesn't fit in a specific prescriptive federal program, or we have state dollars that are flexible that are able to solve an important need of the community. So that is one that we're very excited to be able to have made a part of this funding opportunity. It was a big priority for our partners at the Trust when we discussed this earlier, and we are really happy to have that as a potential tool for our potential resource for people to try and solve the needs in their community.
Okay, do we have any questions for Daniel? All right, thank you, Kathy. Thank you, Daniel. Next, we'd like to ask Susan Masante of the Department of Health and Social Services, Division of Behavioral Health, to give an update.
Good afternoon. My name is Susan Musante. I'm with the Department of Health and Social Services, the Division of Behavioral Health, and I manage a unit called the Recovery Supports and Services Unit, and that includes all things housing and all things employment related, and currently, and we've added recovery supports and are working very hard on workforce development to develop a strong workforce that includes people who are trained and certified, who themselves have a lived experience by way of working with folks that have similar experiences to them. So I almost want to start with answering the questions, but before I do that, since I have a list of questions now, thank you, Mike, and others. I also want to say that we have enjoyed a great partnership with the Trust, with AHFC, and I think that, and our service providers and our housing providers, and I think that we have a formula that works. So it's true we don't have enough affordable housing. It's true we don't have enough appropriate and adequate services, but where we are able to marry those together, we're having a great success. And a good example is the Moving Home Program vouchers, where folks come to us with a sponsoring agency. They do not have to engage in services if they do not want to, but the agency has the responsibility to be available to provide the services and offer those in an assertive fashion to people. And this way, people are getting through the application process much more quickly than they would on their own. And it takes days or less. So when an application comes in, if it's a complete application, that application gets screened immediately by a DBH staff person, and then it moves back over to AHFC to do the other parts of the eligibility. So we're moving them pretty quickly, and that's the way we've done it with the Moving Home Program. We did model the 50 mainstream vouchers, which we're hoping will be very efficient at utilizing, so that maybe we can take part, model after the VASH and see if we can't get some more vouchers if we're that efficient, and that's what we're aiming for. The Moving Home Program has been, over the long haul, been a really completely utilized recently. We've had some turnover, so the good news is that it's had good retention. Folks have over 90% retention rate using that formula of affordable housing and services being offered assertively to them. And we do that through our network of service providers, both the SDS and Division of Behavioral Health. But recently we've had some turnover, so there are some vouchers, and these are tenant-based vouchers available throughout the state. Not a lot, but there's a few, and those are listed on the DBH website. And Anchorage has had a very long waiting list for their vouchers, for the Moving Home Program vouchers, and we just opened up the Anchorage wait list. So I think that's the good news about the Moving Home Program. As I said, we're modeling the mainstream vouchers after that because we were so successful with that. I want to also talk about changes to the 811 Project Rental Assistance Program. So that's a program that's had a slow start. I think everybody's aware of that. We're in the process of opening up the target population. So we had a tier 1, which is people who live in assisted living homes who access general relief. And those are the priorities. That's what we applied for when AHFC made the application to HUD. But we are now opening it up to individuals who are discharging from institutions such as API or the Department of Corrections, who might otherwise be referred to an assisted living home. And the other population will be youth who are aging out of foster care, institutional settings, or transitioning from adolescent service system to the adult service system. So I think that's good news to some folks in this room. I also want to add that in addition to our housing services and these include a full range. Again, they're not everywhere. We do have one ACT team. We're getting lots of inquiries about ACT teams around the state. We know that's effective for a particular population. It's not for everybody, but it's for a particular population. And also our intensive case management program. We are able to do some outreach for homeless people with limited federal dollars through the PATH program. This year we made a change in that, so half of that funding is in the Anchorage area and the other half of that is in the Fairbanks area. So we've spread it out a little bit. It's only $300,000, but it does pay for things that, for example, Medicaid will not pay for outreach and engagement, and the PATH program can allow us to do that and for programs to get reimbursed for that. We are also focusing not just on housing, but really on people's self-sufficiency for more than one reason. One is we know that we have to have affordable housing, but we also want to help people be able to afford the housing that's there by working. And so we have grown in the last 2 years what were 3 supported employment programs for behavioral health individuals, grant funded, to 6. We're going to continue to grow that. We also have some other employment programs. So there's employment services attached to the ACT team, for example, in Anchorage. We're going to continue to do that so that we're really looking at a whole person recovery. And we are also, when we make applications to the federal government, we are building in, whenever we can do it, housing funding for housing supports, and also for housing subsidies as is appropriate, so that we're continuing to use what has become a very successful formula for us. So that's my short version. I know it's getting late in the day, and did I answer your questions, or do you have more questions?
So I'll ask you the same question I asked Kathy. Mm-hmm. So how long does it take somebody will it take them to get through the process to get one of those new vouchers? If
an application comes in on a Wednesday afternoon, by Thursday it's been recorded into our database. We have a spreadsheet. If there's missing pieces to it, someone will call the sponsoring agency and say, we're missing these pieces. So then in that case, it depends upon how long it takes to get the information back that we need. And then it gets moved to AHFC. I think that some of the length has been because there've been waiting lists. We just haven't had enough subsidies. So that obviously takes time.
So when agencies or other applicants, when I hear them say that they're waiting somewhere between DBH and AHFC for an answer, you don't think that's correct? That if there's a delay, it's because the applicant or their sponsoring agency hasn't provided the information?
Which program? Moving home program?
I believe so.
So we had full utilization of those vouchers, so they were probably waiting months because there were no vouchers available.
Right.
So
I think this
we're
was an
working down our
eligibility
list.
determination.
Have them call me. I'm not aware of that. It moves pretty quickly out our door. So our eligibility is very simple.
Right.
Do they have a disability? Do they have a sponsoring agency? If they don't have a sponsoring agency, can we help them get a sponsoring agency so that they have the support to get through the application process? And then it goes to AHFC, who does the sort of the HUD eligibility, the income eligibility, the other pieces of it. There are instances where folks are not eligible for one reason or another for HUD programs. There's a couple of rule-outs for most of the HUD programs, one of which is someone is on the lifetime list for sex offenders, some drug-related felony charges. But there is an appeals process. So when somebody is denied eligibility for one reason or another, that might take longer because they're going through an appeals process.
Thanks. Any other questions for Susan?
And by the way, please, if someone's waiting a really long time, I'm glad to have them call me. So.
Scott?
One follow-up question. So for the Moving Home program and the 811, what does the distribution of the vouchers look like around the state? And are you seeing any barriers for rural or semi-rural communities to access these programs?
The big barrier, of course, in rural communities, is lack of housing. In the Moving Home program, we had it distributed by population. So obviously Anchorage got the majority of the vouchers, but the rest were distributed throughout the state in different populated areas. The mainstream voucher, it's only 50 vouchers right now, but we also are distributing them throughout the state. Anchorage, Juneau, Fairbanks, Soldotna, Homer. Did I miss? That's it.
So available units is the key.
What's that?
So lack of available units is kind of the key.
Well, available units, it has to go hand in hand. I mean, I think you summarized quite well that, we have to have the services, but we also have to have the units. And if we don't sort of marry them, we're not as successful. Questions?
Okay, any other questions for Susan? All right, thank you. Mental Health Trust Authority, Kelda Barstad. Welcome.
Good afternoon. I'm Kelda Barstad with the Alaska Mental Health Trust Authority. I'm the program officer with the focus areas of housing and long-term services and supports. I would like to share with you the Trust's ongoing commitment to the housing focus area. We've worked with many of your agencies and communities to help build housing programs and support service programs that serve not only homeless populations, but populations that have additional barriers to be housed, including behavioral health issues, substance use disorders, intellectual developmental disabilities, traumatic brain injury, or Alzheimer's disease and related dementia. And those are our beneficiary categories that we focus on. Our mission is to improve the lives and prevent the institutionalization of our beneficiaries. And through the housing focus area, it is a literal foundation to health, wellness, and personal success. Any of us in this room, if we weren't able to go to a stable home every day, would be less successful in our day-to-day lives. We would be focused on ensuring that we have that consistent home to go to, that base of operations. And it's no different for our beneficiaries. That's an absolutely critical piece to have in your life if you're going to meet your goals. And if you have additional barriers, whether that be a medical diagnosis, a behavioral health diagnosis that requires additional energy and resources and time every single day to ensure that you can do the same things day to day as anyone else can, that housing becomes even more critical in that person's individual success and safety. So I would like to reiterate the commitment that we have. We will continue to have the housing focus area. We have a variety of different commitments that we've made through our 2020 budget process. We went through our stakeholder process earlier in the year and our 2020 budgeting process with our trustees, and have again made a significant contribute to housing programs. We have over $2.2 million in grant funding committed to housing. And if you include the ACT and ICM funding, that brings that figure to over $3 million. And that doesn't include all of the long-term service and support programs, commitments to disability justice, commitments to improving our behavioral health system, commitments to infant learning and prevention, commitments to employment, commitments to shoring up our workforce so that we can support people who are in need, and all of the other little pieces and parts that we work to foster throughout the state and in communities so that beneficiaries can have better lives. Just to highlight a couple of programs, our partners have already done a fantastic job highlighting this work that's in action. Alaska Housing Finance Corporation, we partner together on the Homeless Assistance Project and the Special Needs Housing Grant, which provides a significant number of housing units and critical services to homeless individuals throughout the state. And we're working together with other partners, including the Department of Corrections, on some creative solutions to housing special populations that don't quite fit the regular model. So those are pretty exciting projects to be working on. We're working on training for our assisted living homes to figure out how staff can better be prepared to work with complex people that come to receive both housing and services in that environment so that they can be successful and maintain tenancy in those assisted living homes, despite some very challenging symptoms and some challenging behaviors that emerge because of those symptoms. We fund home modifications through the Department of Health and Social Services. That helps people stay independent in their homes if they need physical, environmental modifications to stay independent. And that little bit of assistance could mean thousands or even hundreds of thousands of dollars of savings to the state to prevent somebody from entering a nursing facility or higher level of care. Our housing coordinators are amazing. Right now we fund housing coordinators in Anchorage, Fairbanks, and Juneau. They are amazing catalysts for change. I can't talk enough about all three of them and all of the wonderful work that they've done, both for their communities and to creatively solve the problems unique to their community while also enriching the state with ideas and solutions to problems that exist throughout the state. And then in 2020, we will be turning over one of our housing coordinator positions. One of the unique features of our housing coordinators is that generally we'll jumpstart the position and make a commitment with a local government for about 3 years. And then that local government will take on the role of moving that work of coordinating homeless services and housing internally. So we will have a new housing coordinator in 2020, and I'm really excited to do the work of searching for that this year, and I'm sure after this announcement I'll have lots of recommendations. And then one final piece is providing some funding to Alaska Legal Services to help our beneficiaries understand and navigate that eviction process, fight wrongful evictions, and get the support that they need for that process and to understand how they might be able to negotiate out of it. The assertive community treatment and intensive case management, I'll do a little plug. We have a session tomorrow afternoon, last slot on Friday. I know everybody's really looking forward to attending that one. But we'll be talking about assertive community treatment and intensive case management and how that can add to the variety of different services that are available and really help turn the corner between some of the emergency room, homeless services, and housing issues that can be that perfect storm of making a person feel really difficult to serve. And how do you get through that? How do you alleviate those high dollar crisis investments and connect with that person to person, and have that investment be personal, be real, and really get that person involved into a service system that meets their needs and helps solve some of those crisis issues. And with that, I'll be happy to take any questions that you have.
Okay, thanks, Kelda. Do we have any questions for Kelda? All right, thank you. We really appreciate your partnership.
Thank you.
And our final update is from the Alaska Department of Corrections, Morgan Jacob.
Hello.
Hi, welcome, Morgan.
My name is Morgan Jacob. I work for the Department of Corrections. Just here representing Commissioner and leadership. So I'm not sure if we have an update in your pamphlet or not. I don't believe so this year. So I'll just give you guys a brief overview of kind of where we've been and what we're up to. Where to start? Housing is an extremely important and vital need for all of our individuals transitioning out. It's definitely, one of the biggest factors. I really like what that doctor said about the prescription being home. I take that to heart and really see that as one of the main factors in reducing recidivism and how we need to work together as a state agencies and with the community and all of our partnerships to continue to expand on those relationships. In terms of what the department's been doing in the past year, we've really looked at how to implement a coordination of care model, stealing it from the Housing and Homeless Coalition. We were looking around, I was writing a grant in 2016 and started looking at coordinated entry and kind of what that means and how we can parallel and adapt some of that. As a Department of Corrections, when we're trying to streamline services and really work with individuals for their identified needs coming out, and how do we make that work through referrals and processes with our institutional probation officers that are the ones doing that release planning, and then following up with the individuals on the outside that are assisting all these transitioning folks. So that's been a really hard process, as you guys have heard from these housing coalitions for years now, of how to get that implemented, what that looks like. We're still working as a department to try to figure that out. That kind of starts from the inside, obviously, and how we can work with our institutional POs that are working with the individuals for their case planning. Similar to the Housing and Homeless Coalitions, when individuals are looking at the VI SPDAT score and the vulnerability, we look at the LSIR and their risk of recidivating. So that's kind of how our institutional POs are looking at their needs, and housing is always an identified need. So as a state agency, we're trying to coordinate with all of the coalitions. I know I've talked to the Anchorage Coalition and folks about being an access point. I know that's not going to happen at this point. I'm going to look back at Jasmine because we talked about it yesterday. But that's something that I think is really important. We have individuals that are transitioning out of our institutions every day, and some of them are reporting to Brother Francis Shelter. Some of them are reporting to the rescue missions in different areas. And how do we work together to kind of find a different solution? And we're really trying to look at that pre-release instead of post-release because we're losing people right out the door. And I think the Reentry Center, Kathleen back there can attest to this, that she put somebody in housing that night, and it's extremely important that that can occurs because there's just everybody knows what happens when somebody's homeless. So. In terms of our partners, we are continuing to try to expand on that. We work very heavily with Alaska Housing and Finance Corporation. We've heard about the moving home programs. The Department of Corrections works with them on the returning home program. Sir, to speak to possible question that you might ask me, we do have that wait time that I'm hearing is a problem. One thing that we have started doing as a department is we've changed that process of the way the application will be processed through our department. So it's stopping coming to the central office and just going back down to the ground level and to the different field offices so they can understand what's happening right then and move it directly out. So that's something that we're trying to do as a department to break down the barriers that we've put up just because of bureaucratic processes and trying to check boxes. We're trying to look at how we can break down some of those barriers, and we've looked at putting that back out into the field. The probation supervisors are working with their specific probation officers that are working with those clients coming out the door. So we're trying to look at that wait list. We did have an increase in vouchers, and we've continued to try to move people through that need those. It's a great it's a great opportunity. It's a great asset for individuals coming out. One of the limitations of that is it's not an instant access for the day of the release, and we're still working on how to look at those type of needs. So that's one of those issues. We are continuing to look at expanding different opportunities. How do we look at different service providers? In the legislative session last year, we were talking about the procurement process, and part of what we're doing with the looking at smaller housing models, we're still trying to address that. That's really important for us because everybody has different transitional needs, and as a department, we're trying to figure out how to get people into different houses, whether it's a smaller one that can really attest to what they need as an individual. It might look like a specific group of individuals that are going through treatment together, maybe a specific house for veterans, and what that looks like. And a smaller therapeutic type living community also will help with those daily living skills that we kind of, a lot of people don't think about the fact that when we have people releasing from institutions, they've been inside and they're consistently being told when to get up, when to eat. They're not, specifically doing their dishes. And so coming back into the community in a different way where we can have smaller homes and have them be accountable in that type of family unit is something that we're really looking at helping reduce recidivism. I think family reunification is it can be a big problem. So when we have people going back straight into their homes and then just not understanding how to live or how to work within that their small family, it can be a problem. So that's kind of why we're looking at those smaller transitional homes and how to get people out differently. The CRCs might be good solutions for some folks, and that's why we're just trying to find a wide variety of options for housing. Let's see, we're also looking at those peer support driven models, really looking at how peer support can help within the infrastructure of the department inside the institutions and outside within the probation offices, within housing, just as a peer walking someone through that transition. We are continuing to work. I heard somebody mention Pay for Success project. As a department, we are focusing on how we can assist in any way to get people to whatever different grants or housing programs that are going to be out there. Just sharing some limitations. When I was kind of hearing people speak, I'm just sharing these so people can kind of understand where we're coming from. We have a lot of data sharing limitations. I think I heard some people mention that before. So when we're trying, part of the Pay for Success project is how are we identifying these people to get to these programs. So we've got some data sharing issues. Part of that's communication issues. How do we ensure that we have the institutional probation officers working with folks so they do have applications set pre-release, and we understand who's coming out and what their needs are. We also have different treatment conditions and supervision conditions that sometimes individuals that want to go back home can't. And so but then we have that issue where they are here in Anchorage, and how do we get them into housing that might be temporary and get them into the programs where we can get them back home to where they want to be. That might mean expanding and looking at how we can work with our rural partners more. That's something that we're really focusing on in the upcoming year. Working with our rural communities and different tribal entities to try to gain more partnerships through that. We want to make sure that the housing is safe and sober, and that the victims are safe as well. So that's just something kind of we're working on, that fine line of, and that's kind of a limitation of ours. I think that's really recently we put out an RFI, request for information, for housing providers and for service providers. DOC received the planning grant for the Second Chance Strategic Planning Grant last year, and last month we received the implementation grant. So that will be bringing in $1 million over 2 years for really infrastructure of improving the department's communication efforts, how we can help train staff, how we can case manage and figure out individuals' needs a little bit differently. And it's going to kind of help supplement all of that, but some of this will go to funding for services and housing providers, and that's why that RFI is out. So if you see that, that's kind of where that's from, the Second Chance Grant. Questions?
All right, do we have questions for Morgan? Yep, Brenda.
Just a comment. If everybody hasn't seen the Inside Out, I believe done by the Mental Health Trust, that was so insightful to just see the difference between somebody who went directly from, the gates there to housing versus somebody who went from the gates to walking to the bus to the probation office to the
walking
bus
to
the back to the other one, and then following that to see the long-term impact was I appreciate that being done in such with real people. It was I thought just eye-opening. So, and thank you all for the work even though I know you still have some data sharing pieces to go. I remember years ago being like, can't the field POs and the internal POs talk?
Yeah.
And it's so cool. They talk and they have conversations and they share data, and also with providers. So thank you for the work that has been done. It's showing.
Thanks. We're getting there. We will continue on.
Do we have any questions? Any more questions from Warren? All right, thank you very much.
Thanks.
Before we adjourn, are there any comments from any of the council members? Yeah, Santa.
This is Santa Eford again, Department of Education and Early Development. I want to make, of course, we've heard in Scott's summary, I think one other piece are our youth that are homeless, and we've heard that case made by a number from our different coalitions. Dr. Sager, I think I say his name right, that made the case about our youth cannot be successful in school if they don't have a stable housing situation, or the overcrowding, as we talked about, that does not provide them a space to rest, to have a quiet area to do homework. So I wanted to point out that through the McKinney-Vento federal dollars that schools receive, that money should be used to help those homeless students access all of the same academic programs available to any student. So please reach out to any of your local school districts. They should have a homeless liaison person identified. If they don't, please contact the department. That's one of our challenges, are keeping those homeless liaisons consistent and stable in the school districts. But the department can also help connect you with someone there, because those McKinney-Vento funds And the districts are also supposed to set aside Title I funds for their homeless students to be used even if they're in a shelter or some other situation that could be maybe help in a different way to make sure that they are not dropping out of school, that they are accessing those educational opportunities. So.
All right. Thank you. Do you have anybody else? All right, thank you very much. I mean, we hope to see as we continue the process, it's obvious that the agencies work well together. The communication can certainly be improved. And we hope that every time we do get together, we see progress and we see everybody being farther down the road than we were the last time we met. So with that, thank you very much. Thanks, Brian.